Morning. I call this hearing to order. I want to welcome all members, witnesses, and guests to this hearing today. I know this event, which we hold every year, looks a bit different this time, so I want to go over some items to ensure we have as smooth and engaging a presentation as possible. First, if you're experiencing connectivity issues, please make sure you or your staff contact our designated technical support so those issues can be resolved immediately. To ensure our members and participants can have robust engagement, I ask that members participating remotely continue to remain visible on camera for the duration of their participation in the hearing, unless they experience connectivity issues or other technical problems that render the member unable to fully participate on camera. We have a lot of participants and members in this hearing today, so I will follow the House Committee on Veterans Affairs policy that members remain muted when not recognized, just like turning your microphone on and off during an in-person hearing. This is out of courtesy to all members on the committee, our witnesses and guests, and so that background noise does not interfere with another member who is recognized to speak. As previously noticed, we will recognize members in two groups today. First, in order of seniority, we will recognize members who were present before the gavel. Second, in order of seniority, we will recognize members who were present after the gavel. Questions will alternate between members and between the majority and minorities members present. Finally, members will be recognized for 3 minutes during each panel. Today, we will be using a virtual timer to keep time. To keep the timer in your view on your main screen, select grid and focus, or grid or focus view. You can select either grid or focus view. Move your mouse over the second thumbnail from the right. Click on the white circle and select Lock Participant. And from the list of participants, choose Hearing Timer. This will keep the timer in your view. When you are recognized, you will need to unmute your microphone, pause for 2 or 3 seconds before speaking so that your words are captured on the live stream. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteransaffairs.hearings@mail.house.gov. It will be uploaded to the committee document repository. Does any member have a question about the procedures for this hearing? I see none and I hear none, so we will proceed. First of all, I just want to ask Ranking Member Bost to give me a thumbs up if the Marine plaque is positioned correctly behind me in its proper place. Ranking Member Bost, give me a thumbs up if that's the case. Thank you, thank you. Welcome everyone to the joint hearing of the House and Senate Committees on Veterans Affairs to receive the legislative presentations of disabled American veterans and multiple veteran service organizations. It is an honor to join all the members of the House and Senate Committees on Veterans Affairs virtually to hear directly from veteran service organizations that represent millions of veterans and their families. I would like to welcome all DAV members and members of the auxiliary who have joined us online today. We will hear DAV's testimony on our first panel. I would also like to welcome the Blinded Veterans Association, National Association of State Directors of Veterans Affairs, Military Officers Association of America, Student Veterans of America, Minority Veterans of America, National Coalition for Homeless Veterans, and who we will hear from on today's who we will hear from on today's second panel. I especially want to welcome MVA, and NCHV, who will be testifying for the first time at our yearly legislative presentations. Inviting groups that specifically advocate for minority and underserved veterans is a crucial first step toward our goal to create a more welcoming VA. I would also like to specifically welcome any members from my home state of California. Normally we would have a room full of visiting veterans and we would hear a raucous cheer from our home state. We may not be in the same room like in years past due to the ongoing pandemic, but I want to welcome you and thank you for joining us today virtually. The opportunity to hear from our VSO partners is incredibly important to me. Our VSO partners represent veterans and their families at all stages of life and service, and hearing from these partners allows the committee the opportunity to hear directly from you about what is most important to you and how we can best be of service to our nation's veterans. This is another way we can also hear from veterans directly, as many of those participating today bring their own veterans' experience to the table. Well, this is one platform that allows us to hear many voices. We plan to continue to promote the inclusion of more diverse voices, more diverse veteran voices beyond today's hearing. The point is incredibly important, or this point is incredibly important as we face the challenge of a global pandemic, and it gives us the opportunity to discuss ways to build better veterans programs that can overcome the difficulties of future crises and address problems for all veterans. In the last Congress together, we secured several important wins for veterans, including the passage of the Blue Water Navy Vietnam Veterans Act, the Deborah Sampson's Act, the Veterans Compact Act, and the Commander Hannon Act. And I'm very proud of these accomplishments, but they are only the beginning. We need to build on these achievements and continue our fight for better veterans programs in this Congress and beyond. Now, already, we are making critical fixes to expand VA's ability to provide COVID-19 vaccines to veterans and their caregivers. I want to thank my colleague, Ranking Member Boss, for introducing the VA Vaccine Act with me, which will make this essential fix to expand VA's authority and allow them to provide access to all veterans, regardless of VA enrollment, and also as well as the authority to administer vaccine to their caregivers. Additionally, we are close to closing the 90-10 loophole to provide more education protections for service members, veterans, and American taxpayers. Reading your testimony, it is clear your priorities align with mine, with my own, and my committee's top priorities for this Congress include creating a more inclusive and welcoming VA, building equity for an increasingly diverse veterans community, reducing veteran suicide, addressing toxic exposure, ensuring student veterans receive quality education, advocating for women veterans, modernizing VA, supporting VA's long-term care facilities, improving VA's management and oversight, and ensuring our legislative accomplishments are implemented effectively. Our diverse veterans community includes more women, LGBTQ+ veterans, Black, Asian, Hispanic, and Native veterans than ever before. Our country's diversity strengthens our armed forces and veterans communities, and they deserve to have a chance to have a place at VA and to feel safe and welcomed when they walk through VA's doors. Additionally, VA must acknowledge the diversity of its workforce to address systemic discrimination in the workplace. We must ensure that healthcare and benefits are fairly and equitably distributed to all eligible veterans. And to do that, we must also ensure a safe and equitable workplace for VA employees. Our work to prevent veteran suicide continues, and we must continue to pursue well-researched and scientifically sound policies that have been proven to prevent suicide. This Congress, we must also focus on toxic exposure. Too many veterans are suffering from health effects due to exposure to toxic substances during military service. In the 116th Congress, we made major strides in providing benefits to veterans with Agent Orange exposure. We will continue our efforts in this Congress by improving VA's claims process for toxic exposures and looking to provide support to the many veterans who are suffering from other toxic and environmental exposures, such as burn pits. We have big goals, but I know that with your support and insight here today, as well as with the support of the administration, we will be able to deliver on them and fulfill the promises we've made to our nation's veterans. I look forward to hearing your testimony today and thank all the organizations here today for their continued advocacy and support for the veteran community. So thank you. And now, Chairman Tester, I want to recognize you for your opening remarks. Chairman Tester.
Thank you, Chairman Takano, and good morning to everybody. Welcome to the leadership of the Disabled American Veterans. We're grateful to have you here today, and I want to thank the leaders and advocates who will be joining us on the second panel today. We all look forward to hearing from you also. This is undoubtedly a critical and unprecedented time for our nation and for our nation's veterans. At the top of our challenges is pandemic and getting shots into the arms as many veterans as soon as possible. And as the chairman of the Senate Veterans Affairs Committee, my focus is bolstering the vaccine supply chain, ensuring there is a system in place to efficiently and equitably distribute vaccines to all veterans, regardless of where they live. But we need your help getting the word out to our fellow veterans. That's when it's their turn to get the vaccine. They should get one. That is the only way we'll get beyond this pandemic and get our communities and our economies back on track. Commander Whitehead, thank you for all the work that you've done on behalf of disabled veterans while serving as National Commander. We need to hear from you whether the VA is operating in a transparent manner as they execute legislative priorities, including the expansion of the Caregivers program, the John Scott Hannon Mental Health Improvement Act, and the Deborah Sanson Act. For the second panel, I want to hear about how VA's numerous programs are affecting the members of your various organizations. There are a wide range of veterans represented here today. Your testimony will cover a variety of issues vital to ensuring we know what your priorities to work on are this year. Tell me how well transition programs are working, what inequalities minority veterans are facing when it comes to receiving VA services, what VA needs to do to improve its support of state programs, and what we can do to end veteran homelessness, among many other issues. And I want to know how toxic exposure impacts your members. Last year, we worked hard to expand presumptive lists for Agent Orange-related conditions. Now I want to hear your ideas for how we can change the presumptive process to better serve veterans. We're here to listen to you. The voice you and your members provide is an important source of information as we attempt to do right by all veterans. Welcome again. Thank you for all that you and your organizations do on behalf of disabled veterans and their families. With that, I'll turn it back to you, Chairman Takano.
Mr. Bost of Illinois. Mr. Bost and his family have a rich tradition of military service, and I'd like to extend my thanks to him and his family for their traditional service to our country. Ranking Member Bost, you are now recognized for your opening remarks.
Thank you, Chairman, and good morning. It is an honor to join Chairman Takano, Chairman Tester, Ranking Member Moran, in welcoming you here today and joining this hearing. These hearings are unique and one of the highlights of our yearly work. The opportunity to meet in person with VSO leaders and members from across the country is vitally important. I wish we could do that together today, but I'm sure by next year we will be through this and we'll be able to do that next year. I'm also looking forward to shaking your hands and listening to your stories. In the meantime, it is a privilege to be a participant in this hearing and for the first time as the Republican for the House Committee on Veterans Affairs as the ranking member. I am looking forward to this visit, but I'm also looking forward and letting you know that I have big shoes to fill. My predecessors served this committee with the entire veteran community with distinction. They left an incredible legacy of achievement behind. I'm excited to continue their work they started and to get things done for veterans and their families. Please know this, I'm committed to working with each and every one of you to find common ground and address the tough issues that affect the men and women of your organizations every day. my door is always open. As Chairman Takano mentioned, I am a Marine veteran. My father and grandfather served before me. My son and grandson are serving now. This work is deeply personal to me and my family, just as it is for all of you and your families. I do not take this responsibility or this role lightly. Before I continue with my opening remarks, I did want to take a moment, though, to thank each and every one of you for your service, both in uniform and out. Our communities rely on your Washington, D.C. staffs to offer key insight on legislation and oversight. And as important as that is, I know that that's just a fraction of the work that your organizations do every day to serve veterans and their families all across this country. And I want to say thank you. It is because of the support from organizations like yours that there have been so many positive changes underway at the VA in the last several years. I've seen the rising veterans' trust and satisfaction scores, and I don't think they are exaggerated. Your advocacy and input is essential. Your policies you have helped us put up and put forth are working. But like all virtuous endeavors, our work is never done. We must continue to build on the changes that are underway. As ranking member, my priority to this Congress include overseeing VA's continuing response to the COVID-19 pandemic, overseeing the implementation of our recent legislative successes, creating a pathway to care and benefit for our veterans exposed to burn pits and or any other toxins, strengthening services for women veterans, preventing veteran suicide, improving the transition process, preserving veterans' choice and increasing access to care, protecting veterans' Second Amendment rights, and modernizing the VA's outdated IT system. I am aware that it is an ambiguous agenda. It's an ambitious agenda and not one that I can do alone. We will never know all the names or hear all the stories, but it's our duty to work together to deliver real results for the men and women who raise their right hand and in service to this great nation. We have a responsibility to serve them once they return home. We have a responsibility to put their needs above partisan politics. We have a responsibility to get things done. Because in many cases, we're the only advocates they've got. On behalf of them and the future generations of warriors to come, I look forward to working with you to be the best that we can be. Thank you all for being here today, and with that, I yield back.
Trying to unmute. I'm having trouble unmute. There it goes. Thank you, Ranking Member Bost. Ranking Member Moran, before I recognize you for your opening statement, let me just say that I appreciated the bipartisan common ground we found in the last Congress. It was very productive. So I recognize you for your opening remarks.
Chairman Takano, thank you very much, and I appreciate our working relationship when you and I were both chairman for the last 2 years. And to my new chairman, we're working together as we have in the past, which is a good thing. I congratulate Ranking Member Bost on his arrival as the ranking member. Thank him for his service and now his service in even a broader opportunity to veterans. And I welcome my new Kansas colleague to the House Veterans Affairs Committee, Tracy Mann. Tracy, 24 years ago, when I joined the House of Representatives, I became a member of the House Veterans Affairs Committee. And I wish you well and thank you for your efforts to care for Kansans who serve their nation. I welcome all of our witnesses to this morning's hearing. I know that the virtual format, as we've talked, is a bit unusual. We're all anxious for the opportunity to return to that moment in which we can press the flesh, say our words in person, and congratulate and thank those who served our nation. We are anxious to hear from each of the organizations, their leadership today. They have great passion and expertise. They represent many veterans across the country, and your input is of value to me and to my colleagues. I also extend my gratitude to veterans around the country and especially in Kansas who are watching today, and I thank them for paying attention, and I would welcome their input when the hearing is over to tell me what I should have learned and what I should take away from this opportunity to hear from veterans across the nation. We've accomplished a lot working together in recent years: legislation to help reduce veteran suicide, improve access and choice in healthcare, and provide resources and flexibility to assist veterans during this COVID-19 pandemic. That's just a few examples. I expect that bipartisan effort to continue in the 117th Congress, and I will continue to look to your organizations for our guidance on the issues that you think are most important. As most of you all know, however, the real measure of success is not simply passing legislation, but it's ensuring effective execution of the law and seeing concrete results. Our committees remain engaged in providing oversight of the department's implementation of laws and its use of scarce resources. But the membership of your organizations are our eyes and ears on the ground, indispensable to that oversight. One example of what I'm talking about came last year from Student Veterans of America. Through a quirk in the law, veterans attending school in person who were told because of COVID to shift to a virtual learning environment were on the verge of having their educational assistance benefits reduced, even though their living expenses remained the same. Because of SVA's advocacy, we changed the law and helped thousands of students who otherwise may have had to have dropped out of their educational experience. To Jared Lyon and SVA, I say thank you. To Commander Whitehead, the DAV's advocacy has been just as invaluable. Your focus on improving healthcare for women veterans and monitoring the expansion of family caregiver assistance is critical to our oversight work. I could go on and on citing examples of how each of the organizations that are with us today have aided our collective efforts, but your testimony this morning will make an account of the work that needs to be done today to care for your brothers and sisters in arms that served before you, those that served alongside you, and those that will answer the call to serve after you. All of us should recognize that we're able to enjoy the freedoms and liberties as Americans because of men and women who have served. Part of our collective responsibility is to make clear to the public what our commitment to veterans is and what role the VA and other governmental entities and even the private sector should play in fulfilling our commitment. I know Secretary McDonough feels passionately about this, and I'm grateful to each of your organizations for making it central to your daily work. In concluding, my thank you to each of you again for your testimony. I'm hopeful that this will be our last virtual hearing together, and then we come back in 2022 and have a hearing room packed again with Kansans and veterans from across the country. Chairman Takano, I thank you, and I look forward to our witnesses' testimony.
Is Rashida going to unmute me? Rashida? There goes. Thank you, Senator Moran. I too hope that this year will be the last year that we do virtual hearings. We still have a few more to do this session of Congress. But with the President's announcement that President Biden's announcement that every American who wants a vaccine or wants to be vaccinated by the end of May, that will be possible. So we have a lot of reasons to be optimistic. With the introduction of our first panel, let me begin to announce who will be here today. Today we have Commander Stephen Butch Whitehead, National Commander, Disabled American Veterans. Accompanying Commander Whitehead is Mr. Edward R. Randy Reese Jr., Executive Director of the National Service and Legislative Headquarters. Mr. Jim Marzarlik, National Service Director, Disabled American Veterans, and Ms. Joy J. Elam, National Legislative Director of the Disabled American Veterans. Senator Tester has offered to introduce our first witness. Senator Tester, please go ahead.
Thank you, Chairman Takano, and it is indeed my honor and privilege to introduce the National Commander of the Disabled American Veterans, Stephen Butch Whitehead. Commander Whitehead comes to us from Tremont, Minnesota. He served in the Minnesota Army National Guard from 1991 until 2019, deploying twice overseas and earning a Bronze Star for combat service in Iraq in 2007. He retired at the rank of Command Sergeant Major. Commander Whitehead currently serves as Executive Director of the Disabled American Veterans of Minnesota Foundation and has served as National Commander of the DAV since 2019. During that time, along with his top-notch policy team and network of advocates, he has worked with us in Congress to pass some of the most impactful reforms for veterans in generations. Commander Whitehead, thank you for your service. Thank you for being here to advocate for the needs of your fellow veterans. I look forward to your testimony and to working with you and the upcoming Congress to further build on the work that we have done to ensure that no veteran is left behind. Thank you, and I yield back Chairman Takano.
Still says, okay, it still says. All right. Thank you, Senator Tester, and welcome, Commander Whitehead. You are now recognized for your opening comments.
Thank you, Chairman Tester, for your kind introduction. Chairman Takano and all members of the committees on Veterans Affairs, thank you for providing me the opportunity to present the 2021 legislative program of DAV, Disabled American Veterans, an organization of more than 1 million members forever changing wartime service. My full written statement thoroughly details DAV's legislative priorities for the 117th Congress and reports on our many programs and accomplishments. So today, I'll just highlight some of our most critical policy goals. But before I do, I'd like to introduce my DAV colleagues joining me today. DAV Washington Headquarters Executive Director, Randy Reese, DAV National Service Director, Jim Marszlak, and DAV National Legislative Director, Joy Elam. I also want to thank the many DAV leaders watching this hearing at home who are vital to our organization's success. They include DAV's senior and junior vice commanders and the leaders of the DAV Auxiliary. I also want to extend my gratitude to DAV's National Adjutant, our National Headquarters Executive Director, our National Executive Committee, our National Legislative Interim Committee, as well as my Chief of Staff. Of course, I also want to recognize our dedicated DAV members across the country, hundreds of whom would have been here in person to support me at this hearing, if not for the ongoing pandemic. And finally, I want to thank my wife, Kim, who remains my most steadfast supporter and partner. Mr. Chairman, this past year, DAV commemorated a century of dedicated service to America's veterans, their families, and survivors. While it looked and felt different than we had planned, it gave us an important opportunity to reflect on our organization's history and the lessons we have learned in the face of adversity. DAV was formed in 1920 in the wake of World War I as the influenza pandemic of 1918 drew to its end. We can find many parallels between the time of our establishment and our centennial anniversary. A viral outbreak sweeping the globe, overburdened healthcare system, economic downturn, soaring unemployment, and underlying it all, a pressing need to address critical issues impacting our nation's wartime disabled veterans. I'm proud to say that despite the significant challenges of this past year, and thanks to the dedication and adaptability of our teams in Kentucky, Washington, D.C., and across the nation, DAV's mission did not change and our commitment did not falter. Mr. Chairman, at our core, DAV is rooted in service. When veterans needed us most, as many lost their jobs, fell ill, or became isolated in their homes, DAV members, volunteers, and staff quickly pivoted to provide necessary help and resources. Although our offices across the nations were closed to foot traffic to help limit the spread of the virus, DAV rapidly stood up and staffed a newly toll-free hotline for veterans so our experts could assist them with claims and benefits. Since the pandemic began, we have fielded nearly 190,000 calls, and last year, DAV service officers filed 140,000 new claims for veterans benefits. DAV also established a COVID-19 unemployment relief fund in April to provide financial aid to service-connected disabled veterans who lost employment or small business income in the wake of the outbreak. So far, DAV distributed more than $2 million in unemployment relief nationwide to veterans. And as we watch our unemployment numbers soar last year, and hundreds of thousands of veterans were without work, DAV transformed all of our in-person career fairs to virtual events. Since 2014, our employment program has hosted 700 traditional and virtual career fairs, which has resulted in over 150,000 job offers for active duty service members, Guard and Reserve members, veterans, and spouses who attended. As many of you know, DAV's transportation network has become a resource that veterans rely on for free transportation to their VA medical appointments. Though safety precautions require the program to be halted as the pandemic began, DAV volunteers in my home state of Minnesota and nationwide have proven it's possible to carry on through challenging times by implementing new measures to keep themselves and the veterans they serve safe. Despite COVID-related challenges last year, our volunteers logged almost 10 million miles and provided veterans nearly 250,000 rides to VA hospitals, saving taxpayers more than $18 million. Mr. Chairman, although the full and lasting impact of this pandemic is not yet clear, we do know that there are many issues our nations must stand ready to address. Healthcare is chief among them. Over the course of this pandemic, the VA had to make drastic changes in healthcare delivery. We saw a significant increase in telehealth services as VA adapted to the ever-changing landscape. There have also been serious economic impacts. Nearly 800,000 veterans were left searching for work last summer, with disabled veterans disproportionately affected. How many of those veterans today are still unable to pay their bills, feed their families, and make ends meet? We know that before the pandemic, many veterans were already struggling with post-deployment challenges, mental health issues, and in some cases, thoughts of suicide. While the VA has worked hard to keep veterans connected with their mental health providers, we are concerned that many face dark times. Many have been isolated from friends and family, and many have been without access to the support system and resources they had before the pandemic. We will all need to work together to ensure we do not lose ground in the battle against veteran suicide. And we must also explore the future of VA healthcare will look like in the post-pandemic world. While we have many challenges ahead of us, we know that when we work together, despite obstacles we face, we can make progress. For example, led by your committees, Congress expanded access to benefits and healthcare for Vietnam veterans suffering from impacts of Agent Orange. Last year, more than 30,000 Vietnam veterans gained access to long overdue VA healthcare and received almost $800 million in retroactive benefit payments due to the passage of the Blue Water Navy Vietnam Veterans Act. In addition, this past December, Congress approved legislation to expand the list of presumptive Agent Orange diseases, extending healthcare benefits to thousands more Vietnam veterans and their survivors. We are grateful for this progress, but we must not allow other generations of veterans, like those exposed to burn pits, hazardous chemical agents at K2 base in Uzbekistan, or contaminated water stateside, to endure similar unnecessary delays getting healthcare and benefits. DAV is proud to be the organization that first brought the issue of burn pits to light more than a decade ago. While further research will help us examine the health impacts of these exposures and help determine whether to create presumptive disease associations, there is action Congress can take now to help veterans who serve near burn pits. We want to thank Senator Sullivan and Manchin for reintroducing the Bipartisan Veterans Burn Pits Exposure Recognition Act last week. This bill will create a concession of exposure to burn pits to help veterans more easily prove claims for benefits. We call on Congress to once again take this legislation up and quickly approve it. Mr. Chairman, we know that when veterans are injured or became ill in service, their families are affected as well. We must ensure that they continue to receive recognition and support, particularly when the veterans pass away. As we all know, thousands of veterans have died during this pandemic. And while their official cause of death may be listed as COVID, it is vitally important for survivors to have the relevant service-connected conditions identified as principal or contributing factors in order to file claims for survivor benefits. We ask Congress to pass the Ensuring Survivor Benefits During COVID-19 Act to require identification of these conditions on veterans' death certificates so we can properly care for these families. Another important issue that requires urgent congressional action is the expansion of VA's Comprehensive Caregivers program. As you know, Congress mandated that the expansion of caregiver assistance to all generations of severely disabled veterans in 2 phases. However, the first phase was delayed by a full year due to the VA's failure to certify a new caregiver IT system on time. While veterans of World War II, the Korean and Vietnam War eras became eligible in October, the delay pushed back the start date for the second phase of expansion. That impacts Persian Gulf War veterans and others who were injured or became ill between May 7th, 1975 and September 11th, 2001. we asked Congress to pass legislation and provide full funding to mandate that phase 2 of the expansion be completed this year as the law intended. Another critical policy goal for DAV is ensuring that the VA healthcare system has the resources, personnel, and facilities necessary to provide timely, high-quality care to all enrolled veterans. VA has begun an asset infrastructure review to develop a long-term plan to rebuild and realign VA's facilities to serve veterans where they live. In order to be successful, VA must consult closely with VSOs and veterans who use the VA healthcare system as they design this plan. In addition, Congress must be willing to fully fund the cost of maintaining all of VA's healthcare facilities. Mr. Chairman, this past year has challenged us as a nation in ways none of us could have imagined. But like President Abraham Lincoln, I have faith in America's resilience in such difficult times. He said, quote, "If given the truth, people can be depended upon to meet any national crisis. The great point is to bring them the real facts." Undoubtedly, we'll be experiencing this impact of this pandemic for years to come and must stand prepared to address the long-term ramifications for America's veterans by confronting these new realities. But together, move forward with candor and transparency, we can work to overcome the challenges and setbacks this past year has laid at our nation's doorstep. In closing, thank you for the opportunity to present DAV's 2021 legislative priorities and highlight the many programs and services we provide to our heroes forever changed in service. May God continue to bless DAV, the men and women who serve our great nation, and the United States of America.
Thank you, Commander Whitehead. Your full written testimony will be included in the hearing record so that we can ensure every member and senator has here in this hearing has an opportunity to ask questions. I ask that everyone limit their questions to 3 minutes. I now recognize myself for 3 minutes of questioning. Commander Whitehead, many Americans watched, and the investigations later confirmed that current and former military participated in the January 6th attack on the Capitol and this institution. I know that the DAV responded with some very specific actions and guidance for your membership with regard to those events. Can you tell the Joint Committee here today about your response and why you made the decision you did? Why the DAV made that decision?
Chairman, thank you for that question. I'd like to have my executive director kind of take the overview on that one. Randy, please.
Thank you, Chairman Takano. We certainly was concerned when the events unfolded. It's a national tragedy and should never be repeated. And for those who participated, we think that the full burden of responsibility is theirs to bear, and any members of DAV would be thoroughly vetted and due process provided, and if necessary, their expulsion from DAV.
Well, I certainly appreciate the actions that DAV took, the leadership that DAV exerted, and the example that DAV set. I hope other veteran service organizations will follow DAV's lead. As an ambassador for the Prevents Task Force, we know that you are a strong advocate for suicide prevention. As the suicide epidemic among veterans continues to take its toll, what more can be done, and how can we work together to do it?
Chairman, thank you for that, because that is a very important topic for me. As you know, being an ambassador for Prevents, I was honored to be included in that, because suicide is something that's very important to me, and it's near and dear to my heart for losing friends and also family members to suicide. But I'd like to have my legislative director, Joy Elam, kind of elaborate a little bit more on that. Joy?
Thanks, Commander. Absolutely. You know, we want to thank Congress, the House and Senate Veterans Affairs Committee for the passage of those 2 major pieces of legislation last year. Really comprehensive, and will set the tone for this year in terms of new progress that can be made on suicide. I think 2 things that I would add that VA could do are 2 programs they've already started, but really to ramp them up. One would be the SPED program, which is a program for veterans that are in crisis who come to an emergency room. The emergency providers should make a plan at that time with them where they've got follow-up care after that visit, and to make sure that that veteran gets all the services that they need and the support following that crisis. The other initiative that VA has started relates to lethal means safety storage, so both of medications and firearms for veterans in crisis. Their training program, we want to make sure that VA providers feel comfortable to be able to talk to veterans about the issues that they're experiencing when they're in crisis. They want to keep them safe, both from medications and firearms. So we would say those two programs are critical to really ramp up and to help reduce suicide in the veteran population.
Well, thank you, Ms. Elam, for your comments about firearm safety. My time has expired. I recognize Senator Tester for his 3 minutes of questioning.
Thank you, Chairman Takano, and I want to thank you, Commander Whitehead, for your testimony and your input into our agenda for this next year. Look, vaccine is critically important, as I said in my opening remarks. We had a hearing in Senate Veterans Affairs last week with VHA and Dr. Stone, and learned that vaccine hesitancy is an issue for some veterans, especially in rural areas. And it's not just in places like Kansas and Montana, it's places all over the country. My question is how can DAV help communicate to veterans about the importance of this vaccine and dispel any myths that may be out there about this vaccine?
Well, Senator, thank you, because obviously that's important to me. Being a leader in the National Guard, I too have already taken my vaccine, and I've actually done videos and actually done messaging out there. So even in the military, our soldiers are getting it. But on the DAV side, I'd like to have my Legislative Director, Joy Elam, kind of highlight a few things that she sees that the VA can do. Joy?
I would just add that DAV and the VSO community in general can really help with this issue, especially in rural communities. Our leaders need to step forward. They need to lead. They need to make people feel comfortable, get the information that VA is making available when it's their turn to get the vaccine. We want to, as everyone has indicated this morning in their opening remarks, we want to see the pandemic in the rear view, and that means getting everyone vaccinated and feeling comfortable that there is a safe way to do that, getting their vaccine.
Thank you for that. Look, toxic exposure is a huge issue. We did some good work last Congress. I had a bill for bladder cancer, hypothyroidism, and Parkinsonism, and with help from Jerry Moran and others, we were able to get that across the finish line on the presumptives for Agent Orange. But we have more to do, and I want you to comment on hypertension and MGUS, monoclonal gammopathy and undetermined significance, which is a mouthful in and of itself. It is my understanding that those two, hypertension and MGUS, have even a greater association with Agent Orange than the ones we added last year. Is that true from your perspective?
Senator, that's a great point, because I want to first of all thank you and this committee, for that hard work getting those added, because that was a huge win for our Vietnam veterans and all those affected by these toxics. So thank you for that work. But if I can have my service director, Jim, to kind of highlight a few more on that, Jim.
Thank you, Commander. Thank you, Senator. Great question, and you are absolutely correct. Hypertension and MGUS are at a much higher level than the three recent added conditions. So it's time. It's time for VA to act and to add hypertension and MGUS as a presumptive condition for these veterans. They've waited long enough. It's time to add them now.
Amen. And I look forward to working with the DAV and all VSOs on the presumptive issues. So thank you, Mr. Chairman. I yield back.
Thank you, Chairman Tester. I now recognize Ranking Member Bost for 3 minutes.
Thank you, Chairman. And, if we can, last week, Chairman Takano and I introduced the VA Vaccine Act. This bill would expand the vaccine to all veterans and caregivers of those who are in certain categories for long-term and home-based care programs. Our bill requires enrollment for the veterans to be prioritized first, and provided the vaccine access as long as it is available for the dependents and also available for their caregivers. Do you support this bill? And if so, why or why not?
Ranking member, thank you for that question, because it is very important, as we've heard everybody's comments. Getting this vaccine in the bodies is what we need. We need to do that right away. But if I could have my legislative director, Joy, kind of highlight a few more things that we see. Joy?
Yes, we absolutely are pleased to support the bill and appreciate the bipartisan introduction of it. We understand, especially for many of our caregivers, it's important they're there with that veteran every day. We want to make sure all veterans have the opportunity to get vaccinated as soon as possible. And we know VA is going to be a leader in this regard. As they get more supply, I'm sure they'll ramp up.
Thank you. Thank you. One thing, and this is kind of a personal question just to get you to direct towards me. The last several years, we've had tremendous productivity and success on the committees. Now, as ranking member, where do you think my focus should be? I've told you in my opening where our focus is at, but where would you suggest my focus should be for racking up the biggest wins that we can for veterans and their families?
I'll go ahead and say we do appreciate, I think, you and Chairman Takano working closely together. A number of the priorities that he mentioned this morning, I know are important to you as well. And I think that's critical. We've mentioned several of them here today. I think that we all agree that we can all work together on, toxic exposures, making sure veterans don't have to wait. Really looking at the framework of presumptive disabilities and making sure COVID first and foremost, that veterans get the care they need. We get this pandemic behind us, and caregiver support and other things that have been mentioned. So we look forward to working with both of you to accomplish those goals.
Thank you. And once again, I want to thank you for what you do. And with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Bost. I now recognize Ranking Member Senator Moran for 3 minutes. Senator Moran, not here.
Chairman Takano, he's got another committee meeting. He'll probably be back, so go ahead and move on.
We'll bring him back. Okay, thank you.
Chairman, I'm here.
Oh, there you are. Okay.
I was here and went away.
Well,
I'm here.
We understand that. So go ahead, Senator Moran. You have 3 minutes.
Thank you very much. Again, thanks you to the witness for the testimony. Let me ask just a couple of questions. The Mission Act provided for the expansion of the Caregiver Support Program to all eras over time. Yet the VA implementation of this expansion was delayed, and they have implemented rules to discharge an estimated 8,000 caregivers from the program's comprehensive assistance. Do you believe the VA should expedite expansion, and how will caregivers of your members be affected when VA discharges them on October 1, 2021?
Senator, you bring up a great point, and you actually heard my speech. This caregivers thing is very important to me. When you guys passed that law, you guys wanted it and implemented it to be effective October 1st, 2021. And that's what we feel as well. That needs to be implemented on time, no more delays. These caregivers have been affected long enough. But if I could have my legislative director kind of highlight a few more, Joy?
Please, I knew this was an issue of importance to you.
Yes, so many caregivers, have been waiting for this so long, and we don't want any further delay, due to those IT issues on the front end that sort of delayed the second part of the expansion. And we do hope that moves forward. And we think a hearing this would be a perfect issue for a hearing. The question that you raised there, that will be difficult for many of those caregivers with the changes in the law, but I do want to say that many of our members, severely disabled veterans who have applied for the comprehensive support program, we've gotten rave reviews from them. They've indicated it's worked well for them, and they've gotten their benefits already. but we know there's many more that have been denied so far, and there's a lot of work to do with regard to this. And we know that many will be really looking for assistance and guidance on that issue.
Thank you for your support and your suggestions of a hearing. Let me see in the little time I have left. In the past 2 years, Congress has passed legislation to eliminate the SBP and DIC offsets and allow DIC recipients to remarry at the age of 55 and still retain their survivor benefits. Does the DAV have additional recommendations about how to support survivors of disabled veterans?
Thanks for that question, Senator. I'm going to ask my service director, Jim, to kind of take that one from me. Jim?
Thank you.
Thank you, Commander. Excellent question. Yes, another idea would be to eliminate the 10-year rule. The DIC program would be more equitable for all survivors if they were eligible for a partial DIC benefit starting at 5 years of the veteran being totally disabled. And we could increase that incrementally until reaching full entitlement at 10 years. Another good one could be removing dependents' educational assistance eliminating date. Currently, surviving spouses only have a 10-year period to apply for those particular benefits and use them. So in many instances, most notably in the case of caregivers, family obligations and the need to care for the service-disabled veteran requires the spouses to defer using these benefits for years. So we feel removing that 10-year delimiting date will be a significant benefit for those survivors.
Thank you for your testimony. Thank you, Chairman Takano.
Thank you, Ranking Member Moran. I now recognize the chair of our Subcommittee on Health and also the chair of what I hope will be the reauthorized Women Veterans Task Force. Did a brilliant job. Representative Brownlee, I recognize you for 3 minutes.
Thank you, Mr. Chairman. And I wanted to just add my voice to express my gratitude to every veteran listening here today, to thank you and your families for your service to our country. I also, Commander, wanted to say to you what a great job Joy Elam does representing your DAV and your membership, and quite frankly, all veterans. She just does an extraordinary job. So thank you for allowing her to do her good work. And I just wanted to say, I appreciate you mentioning in your testimony the importance of the Deborah Sampson Act and the Women's Veterans Task Force. I think we can all agree that there is still a lot more work to be done in this space. But my question really is, Commander Whitehead, what sort of long-term challenges does the VA face right now that will prevent it from providing adequate services to women veterans in the future?
Representative, thank you. Because obviously, being a leader in the military, I have female soldiers around me all the time, and I think one thing the VA needs to understand is the increased number of females joining the military right now, and that continues to grow each year. So the VA has to be prepared to be able to handle that increase as we continue to go down this road as well.
Thank you so much for that. And the other area that I wanted to ask you, you also mentioned, the need for sufficient funding for veterans' health care, which I couldn't agree more. I have a bill actually that requires GAO to verify the accuracy and adequacy of VA's budget for medical care in order to guarantee adequate funding for veterans' health care. Can you explain the importance of adequate funding and the potential consequences of not having enough?
Absolutely, Representative. So I would actually ask Joy to kind of take this one. Joy?
Sure. Funding for VA healthcare is essential for DAV members who are high users of the VA healthcare system. We want to make sure it's a strong, robust system for VA to be able to provide, the comprehensive services that they have available. They need to be able to hire the staff. They need to be able to, make sure that they have the infrastructure that they need. The research component is critical for service-disabled veterans and those connections between their military service and disabilities. So we want to make sure that, that remains an emphasis. We see how important it is, especially during this pandemic, to have access to healthcare and the incredible job that VA has done. So we support that measure. We know the budget is critical. We're part of the independent budget, requesting sufficient funding for VA year after year. And we know that having someone look at those requirements is an important piece of it.
Thank you, Mr. Chairman, and I yield back.
Thank you, Representative Brownlee. Senator Sanders, if you are present, I recognize you for 3 minutes. Otherwise, Senator Sanders, are you here? If not, we'll move to Senator Manchin for 3 minutes. Senator Manchin, you have 3 minutes.
Thank you very much. And Mr. Whitehead, I want to take the opportunity to personally thank you for all the support for the DAV has given to Senator Sullivan and myself in the 116th Congress, and with our bill to get much needed benefits to veterans exposed to open air burn pits. I'm pleased this remains a priority for DAV in the 117th Congress as well. We've got to get this done. History has shown that even after surviving combat or hazardous duty, veterans coming home having been exposed to toxicants that can end up leading to long-term health issues. I think we all know this firsthand. We can't leave them behind, which is why Senator Sullivan and myself reintroduced Senate Bill 437, the Veterans Burns Pit Exposure Act of 2021. As the members of DAV attend the meeting with their congressional representatives, I would encourage them to speak up about their experiences with burn pits, just as you have today. So any response to that, Mr. Whitehead, I would appreciate.
Senator, thank you, because obviously it is very important to, to our members, but even to me personally, somebody that has served in the desert and been near burn pits, I'm concerned about my future and what it's going to have on me and the effects on me as well. So thank you for that work that you're doing in this committee. And we definitely look forward to working with everybody on this.
Well, this is the year for us to pass it. It really is. And I think we're all committed. And I think on both sides, this is a bipartisan amendment that brings us all together, which is what the veterans always have done and the military does today. So thank you very much, and all of you for working so hard, and I yield my time back.
Thank you, Senator Manchin. I now recognize General Bergman for 3 minutes.
Thank you, Mr. Chairman. Thanks to all of you being on the virtual hearing today, and I echo the comments of my colleagues. It'll be great when we can have a shout out, whether it's hooah, hoorah, or I'm not sure what the Air Force says other than cool. But anyway, Mr. Whitehead, you know as well as I do that we still have a tremendously unique, overburdening in some cases, problem among veterans with suicide. You and I are both members of the Prevents Task Force, as national ambassadors. Can you talk about the importance of Prevents and its continuity and mission going forward within the new administration? Because we know after some fits and starts over the last couple of years, the challenges in getting alternative opportunities for veterans to engage who might be at risk, but are definitely outside the VA healthcare system. Could you just again elaborate on the importance of Prevents?
That's an excellent point, and actually I'm honored to be part of the Prevents Ambassador team, because I think it's very important that as a society, we all have to get comfortable talking about our struggles, talking about what's going on in the world, and being able to feel comfortable knowing that it's okay to reach out and ask for help. Being part of the Prevents Ambassador team, I think it's great that we're sharing our experience and our thoughts, getting that out to the general public, to our veterans and to the general public, that it's a strength of us to be able to talk about it and ask for help. And that, I think this current administration, if they can continue to push this and have behind it, that's a great win for all of our veterans.
Thank you. And again, it's we all of us, especially you all out there in the VSOs, you have to be that voice for the veteran and that direct voice so that the administration hears of the importance of the Prevents Task Force. And with that, Mr. Chairman, I yield back.
Thank you, General Bergman. I now recognize Senator Cassidy for 3 minutes. Senator Cassidy.
Thank you, Mr. Chairman. Hey, sir. I'm a doc, and you'll understand where my question is coming from on this. During the pandemic, there has been such an issue with an increasing amount of opioid abuse in the general population. And Congress has attempted to address that by putting funding out there, both to the VA specifically, but to the public in general. And we're hearing reports 40% of Americans are having symptoms of anxiety and depressive disorder. Intuitively, disabled veterans would be at greater risk for this because they are battling physical or emotional disability to begin with. So I guess I'm asking, are you seeing these same trends within the veterans community? And is there anything in particular you would suggest the VA do to attempt to address this?
Senator, I appreciate that question. I would like to have my legislative director, Joy Elam, kind of help elaborate on that. Joy?
Excellent question. I think our recommendation would be we really need to see a balance here. We know VA's mission to really reduce the use of opioids in the veteran population, keeping veterans safe, making sure that addiction doesn't result. But we also have, for service disabled veterans, we have some people that have been really severely injured, dealing with chronic pain issues, which are, really essential to deal with, because that also leads to, if they are unable to work, if they're unable to just function without serious pain, can also lead to mental health issues and suicide. So we want to make sure that there is a good balance for VA, that they're dealing with this in a humane way, that providers are able to do what they feel is clinically appropriate, and they work with veterans that need to be, they have not taking opioids anymore, and they need to really understand their fear about that, their anxiety about that, and to work with them to, step down from that, as well as why, understanding about the safety issues. So we think there's still work that VA needs to do. We know that they have the good, good intentions behind their program, but we do ask for a balance there.
Okay. Mr. Chairman, I yield back.
Thank you, Senator Cassidy. Representative Lamb, if you are present, I recognize you for 3 minutes. Representative Lamb.
Thank you, Mr. Chairman. And I want to thank you, Commander Whitehead, and all of our witnesses for helping us out today and the work you all do every day. It has had a huge impact on my constituents in the whole country. I know. Wanted to return to the topic of January 6th for a moment. And first of all, thank you for the active voice that you've had in the wake of that. I'm a strong believer that as veterans, we really need to police our own on this, regardless of what party you're in, regardless of who you supported in the election. The fact is that we all took an oath to uphold and defend the Constitution of the United States, and the Capitol that is established by that Constitution was attacked that day. So for me, it's a pretty easy one, which side of this you fall on if you've taken that oath. I was hoping that maybe you could give us just a little bit more detail about any active measures you have taken since January 6th. For example, to identify whether there were any of your members involved in the attack itself. I'm sure all of us saw how many military logos were in that crowd, particularly Marine logos. It's painful for me to see. There have been reports of VSO logos as well, and I just wanted to know if you have seen that or identified any, and whether you have worked with law enforcement to aid their investigation at all.
Representative, thank you for such an important question. Again, I'd like to ask my Executive Director, Randy, kind of elaborate a little bit more on that. Randy?
Thank you, Congressman Lamb. We take it quite seriously. We do review the Department of Justice investigation list against our membership database. And then based upon the investigation details in the complaint that's filed with the Department of Justice, we consider those facts and circumstances. And then once due process is relevant for our administration, we decide whether or not that person should be suspended. And obviously, if they are convicted of a felony of this nature, they would be expelled.
Thank you. So you are relying on the law enforcement cases to identify people among your membership. Are you also doing anything to search publicly available images or otherwise members will involve?
We do rely upon the Department of Justice. We do not use a surveillance program for our membership or those who engage on our social media footprint just due to the size and scope. That's beyond the resources we have available to serve our members.
Okay, thank you again for your participation. I expect that we will be staying on this issue throughout much of the year with an eye toward how we help protect veterans from the recruitment efforts that groups like the Oath Keepers and others have used to target veterans and to give them false and violent and misleading information about their oath. And I look forward to your partnership on that. And just thank you again for everything you've done. Mr.
Thank
Chairman, I
you.
yield
We
back.
certainly look forward to your partnership as well.
Thank you, Mr. Lamb. I now call on Senator Sanders if he is present. Senator, are you here? Otherwise, we'll move to Senator Hassan. Senator Hassan, you're recognized for 3 minutes if you're here. If not Senator Hassan, then we'll move to Senator Rounds. We'll go to Senator Rounds next. Senator Rounds, if you're ready. Senator Rounds is not here. Senator Blumenthal. I don't see Senator Blumenthal. Oh, Representative Pappas, we'll move to you then as the senators file back in. Representative Pappas, 3 minutes.
Well, thank you very much, Mr. Chairman. And I also want to add my comments about looking forward to next year and making sure that we're back in person together, especially so we can salute the veterans from our districts that make the trip down for these important hearings. And certainly I'm thinking of all the veterans across New Hampshire, especially DAV members, as we proceed here. I want to thank Commander Whitehead for your comments, for your focus on toxic exposure in particular. We've been focused in my district on the issue of PFAS contamination at a former Air Force base. And we know that ATSDR is currently conducting a study there to firmly establish a connection between toxic exposure and certain health concerns that are linked to PFAS. But we also know that other health studies have already been done that make the linkage between chronic conditions, including cancer. And so, as we wait for additional health information to come out, I think we have to move as quickly as we possibly can to make sure that we're meeting the needs of veterans and service members with respect to the PFAS issue. So I appreciate your commitment to that. Another important point that you noted was the issue of discrimination faced by women and minority veterans at VA facilities. I'm the chair of the Oversight and Investigation Subcommittee in the House, and we're working on legislation that would improve the sexual harassment reporting process at VA. And this is an issue that our subcommittee is going to be focused on as we move forward. I'm wondering if you could just talk about any next steps that you would hope our committee could take to ensure that our women and minority veterans feel comfortable getting care at VA.
Representative, I appreciate that question. When that first came, I actually did some nice media outlet messaging on that because it's important that every one of our veterans feel safe when they go get their care. And the veteran itself and also the employees of the VA need to feel safe where they work at. But if my service director, or my legislative director, Joy Elam, can maybe elaborate a little bit more on that. Joy?
And we were very pleased that the commander really wanted to step out front on that because we do need leadership with regarding the harassment issue. We were, as an organization, very pleased to see Secretary of VA McDonough and Secretary of DOD Austin come out very right after they were confirmed, both of them, to indicate they're going to be working together dealing with this issue, and the commitment from the VA Secretary was very welcome. That they're going to take a top-down approach to this, and that's serious. So we're looking forward for your committee to really hold them to that it can't just be a slogan or a message, but this this behavior is so destructive and deters veterans who really need the VA healthcare system from getting the care that they need if they feel that they're not in a welcome environment or being harassed while they're seeking care. So appreciate your work.
That's terrific. And my time's up, but I'm wondering if just for the record, you could get back to us on a letter that you had sent to VA asking it to withdraw its appeal of the Wolf versus Wilkie case around emergency care. So if you have any more detail about how we can address that and commitment from VA on that front, we'd love to work with you on it.
Absolutely. We'll follow up with you and your staff. Thank you.
Thank you. I yield back.
Another important issue.
Thank you, Representative Pappas. I call on Representative Rosendale for 3 minutes.
Thank you, Mr. Chair, and thank you, Commander Whitehead and the Disabled American Veterans Organization. Your organization is doing important work to ensure our veterans' needs are being met, and we all greatly appreciate that. I also wanted to say thank you today for all the Montana veterans that are watching today. I wish we could be together in person, but I'm grateful for each of you and your service to our nation. We will never be able to thank you enough for your sacrifices that you and your families have made to protect our freedoms. It's been a pleasure to hear from veterans back home in recent weeks. One item that has been repeatedly mentioned is the success of Freedom's Path at Fort Harrison in Helena, Montana, which is a residential community for veterans experiencing homelessness or at the risk of homelessness. As the son and brother of a Marine, I'm incredibly honored to be here today for this hearing. Our veterans are truly our nation's heroes. 1 in 10 Montanans are veterans or in active service. I'm honored to represent them in Congress and also here on this committee. We've made promises to our veterans, and we must ensure that these promises are kept. Veterans must have access to high-quality health care, and they must be able to efficiently access those benefits. Long wait times for care and barriers in receiving benefits is unacceptable. In order to establish these benefits and deliver them efficiently, we must have information systems that can easily transfer the appropriate information from the Department of Defense to Veterans Affairs networks. To date, billions of dollars have been spent, and we have not begun to approach a reasonable level of success in this issue. Since the start of COVID-19, this has become even more critical. Difficulties and challenges veterans have faced have only been exacerbated by shutdowns and isolations, which leads me to my question. The Technology Modernization Subcommittee has made electronic health records a priority. However, nationwide, we've seen a huge increase in telehealth use. What have your members' experiences been with accessing and utilizing telehealth services since the start of COVID-19 pandemic, and what improvements could be made to expand and improve that delivery? Thank you.
Congressman, thank you for that question. And I would like to ask Joy to kind of take that from me as well. Joy?
Thank you. I think there are a couple of things. We do appreciate how quickly VA ramped up to try to make sure that they could meet the needs of veterans throughout the country through telemedicine and their telehealth program. We still know in certain areas of the country, like where you are from, there can be broadband issues. Veterans may not have had the equipment to use, even if they do have access. So it is incumbent upon these partnerships that VA is trying to expand with community organizations that are willing to have sort of a hub where veterans may be able to go to have access to that, to telehealth. So I think those are great starts on it. There's going to be a lot of lessons learned from this pandemic and the use of telehealth. We know there's going to be pent up demand for being seen in person, but how this will impact is still, the jury is out on that. So we need to watch and make sure that veterans are still getting high quality care, and we learn the lessons from, what worked and what hasn't worked.
Thank you so much. Mr. Chair, I yield back.
Thank you, Representative. I call on Representative Merven for 3 minutes of questioning. Representative?
Thank you, Chairman. I greatly appreciate this opportunity. Commander Whitehead, I thank you for all that you have done for the DAV. As a freshman member and as a coach or as the chair of Technology and Modernization, I want to let you know and all veterans know that we'll work extremely hard in a bipartisan manner to make sure our veterans receive the health care necessary and have the infrastructure with technology and modernization in place to put the VA in a position to be able to handle all challenges post-COVID and as we evolve into the next generation of making sure we're taking care of our veterans. With that, my question is, the VA has faced criticism over its lack of veteran engagement in the electronic health record modernization program. Mr. Whitehead, can you or your staff discuss any communications the DAV has received nationally, or more specifically in the Spokane area, regarding the transition from Vista to Cerna in the millennium?
I appreciate that question, and I actually asked Joy to kind of elaborate on that. Joy?
Great question. I think, you know, the IT issues, this is such an important issue for now decades. You know, there's been trying this attempt of IT modernization and moving forward. Everybody's very anxious about this, that just no one wants this to fail. I think connecting with veterans in the area, I mean, we've seen the GAO report, but it's a very complex issue. And I think we're really going to look to the committee, the subcommittee, to make sure, I mean, there has to be the expertise of people that really understand the complexity of what they're doing. And when GAO puts out recommendations, but VA doesn't agree to them, you know, we'd like to hear, make sure there's a hearing so we can hear the discussion back and forth before, you know, moving forward. So we just, you know, we look forward to your committee and the work that you'll be doing in the year ahead.
Joy, thank you very much. And as they say in Houston, failure is not an option, right? We have to make sure we get this right in a bipartisan effort and work. With that, I yield back my time.
Thank you, Representative. Senator Blumenthal, you're recognized for 3 minutes.
Thank you, Mr. Chair. Really appreciate your being here, Commander Whitehead, and all your service to your fellow veterans and the great team that you have with you. I'm honored always to be on this committee and to hear from veterans about how we should be doing better and more, and most especially for our disabled veterans. I want to ask about an area of disability that may have been touched on briefly, but I want to emphasize toxic exposures. The modern battlefield has been more poisonous and toxic than ever before with all of the chemicals that are found there. I have championed the cause of Agent Orange afflicted veterans, and we've made progress there. I've talked to Secretary McDonough about them and others who may be victims of exposure to chemicals, and most especially the K2 veterans. We have legislation that would advance their cause. I'm concerned that we're repeating the mistakes of the past, and we've discovered, obviously, the Karshi-Karnavad Air Base, which was plagued with many of the chemicals that have caused cancer and other kinds of problems. Have you heard from veterans, and have you noted the inconsistencies in presumption for different types of toxic exposure? And how would you recommend that Congress reform this area of our law?
Senator, thank you for such an important question. I'd like to have my Service Director, Jim Marzlak, kind of take that one for me, Jim?
Of course.
Thank you, Commander. DAV is always concerned when veterans are exposed to toxins and/or environmental hazards during their military service. VA should be equipped to provide health care and service-connected benefits for those exposures. One thing that could happen to make this process a little easier is the overall presumptive making process. we need a good framework to be established by Congress to provide consistency that must improve DoD and VA data collection and record keeping, establish a concession of exposure, require statutory mandated future studies on nodal exposures, provide a time requirement for action by the VA secretary. That's a big one. That's where we're at with hypertension. There's no time requirement for the VA to respond to these recommendations. We can maintain a standard of positive association versus causation. And then finally, I think we could update the classifications of scientific association. This is a very serious topic and it's affecting, countless veterans, and we have to do better.
Thank you for that answer. I'd like to follow up with you because I think this area is supremely important. I also have questions about the treatment of veterans with less than honorable discharges. I know you're focused on the disabilities that may accompany the lack of access to health care and so forth, but my time has expired, so I yield back to the chairman. Thank you.
Thank you, Senator. I appreciate your yielding back. I call on Representative Banks for 3 minutes. Representative Banks, are you present? If Mr. Banks is not ready, we'll move to Senator Tuberville. Senator Tuberville, are you present? There you are, Senator. Go ahead, 3 minutes.
Yeah, thank you very much. Thank you, Commander Whitehead, for your testimony and your service. I'd like to hear about the work your organization does to get disabled vets back into the workforce. These vets we're having now with all these endless wars we've had are younger and younger, and working helps a lot of things. So one thing I'm passionate about is, vocational training and trade schools. Are these options that you have, are they found useful to helping our disabled vets? And what can Congress do to help create more employment opportunities for these veterans?
Senator, I really appreciate that question because employment is a very important thing for the DAV. Obviously, when our veterans get, when they leave the service, it's important that they have good quality jobs to come back to, if that's schooling or going straight to the workforce. But if I could have my service director, Jim, kind of elaborate a little bit more on our employment program, that'd be great. Jim?
Thank you, Commander. And to your question, I'm a proponent of VR&E. I went through the vocational rehabilitation program when I first was hired by Disabled American Veterans, and next month I hit my 20-year anniversary. So it's a wonderful program, and it's led me down a path that's very fulfilling. So on our side for the employment program, DAV is fully committed to ensuring veterans have the tools, resources, and opportunities they need to be to competitively enter the job market and secure meaningful employment. When the pandemic hit, we went to virtual job fairs. We were doing in-person job fairs. We went to a virtual job fair, and over the past year, we're able to ensure that over 5,000 veterans had job offers extended to them. So we take this very serious, and we want to make sure veterans have the opportunity to enter a competitive job market for sure.
Well, thank you. I think it's important that we get them back in the workforce at all possible. I've have friends that are disabled vets, they have PTSD, and of course we're losing 20 to 30 veterans a day to suicide. And I don't think it's anything any more important. Get them back into the real world as quick as we possibly can. And I think Congress should fund some of that. We owe our veterans a whole lot, and more than we can ever repay. And so I think it's important that we get back in the game in a lot of areas to help our veterans get back to a normal life with them and their families. So thank you for what you've done, and hopefully we can help you in any way. I yield my time.
Thank you, Senator Tuberville. I now recognize Representative Mike Levin for 3 minutes. If Representative Levin, you're there? You're still muted, Representative Levin. Can we fix the audio? Why don't we try again, Mr. Levin? I think you're on now. No, I cannot hear Mr. Levin.
How about now?
I can hear you now, Mr. Levin. Go ahead.
It worked. Technology. Thank you, Mr. Chairman. Well, I very much look forward to getting together in person as soon as we can safely. But I want to thank everybody today, and particularly Commander Whitehead for joining us and just for all your work on behalf of veterans with disabilities across the country. I want to give a special shout out to DAV Chapter 95 in Oceanside, California, which does a wonderful job serving our veterans in my district in North County, San Diego. Commander Whitehead, in your testimony, you emphasized how important it is that VA leaders commit to fostering a culture where all veterans are treated with dignity and respect, which has also been a key focus of our Women Veterans Task Force. And one way VA can do this is by prominently displaying messages in facilities, making it abundantly clear that harassment is not tolerated. And that includes comments about appearance or questioning and belittling veteran status. I've heard from veterans in recent years, posters with these messages have been taken down from the walls, and public service announcements have been taken off the TVs in local facilities. The good news is that we're hearing that some of these displays have been restored in recent weeks, but it's important nonetheless to examine what happened and how it affected veterans. My question, Commander, is have you heard stories like these from your members, and what message does it send to veterans when these displays are removed?
Thank you for that question. You know, obviously, a safe environment, like I said earlier, is very important for our veterans when they go into these healthcare facilities to feel safe, to go in and get the quality of care that they deserve. But Joy, if you could elaborate a little bit more on maybe what we've heard on nationwide, that'd be great. Joy?
Sure. I have not heard from DAV members specifically regarding that, but I think if that's happened somewhere, the message is clear. It's saying, you know, we don't have a problem. Which is not the case. And we know that many employees in VA have worked very hard to start work on, you know, their Stand Up, Stop Harassment campaign, their White Ribbon campaign. We hope now with the new VA Secretary McDonough's commitment that, you know, he just will not tolerate harassment in facilities from either veterans or employees, that we're going to really see a culture change, but that will require, you know, a system-wide approach throughout the system, and it will also require them to work with veteran service organizations, the users of the VA healthcare system, to really make that change. So we look forward to helping to do that and standing ready to help make that change.
Well, thank you for that. I'm out of time, but I really look forward to working with you and our other VSOs to do all we can to end sexual harassment and assault at the VA. Mr. Chairman, I yield back.
Thank you, Representative Levin. I now recognize Representative Murphy for 3 minutes. Representative Murphy. Representative, hold on just a second. We're not hearing you through the audio.
Thank you, Mr. Chairman. We good?
There you go.
Yeah, thank you, Mr. Chairman, and thank you to all the panelists who have come today in representation of our veterans. My district has the 6th most populace as far as veterans in the nation here in Eastern North Carolina, and I wanted to thank you for all the hard work that you're doing. One particular issue that is very, very critical to me and very, very important to me is the issue of PTSD and TBI. I am a physician. And understand the consequences that go along with some of these blast injuries, and what a critical effort it is to support our veterans who come home after combat suffering from PTSD and TBI. I've toured our places in Camp Lejeune, our Intrepid Center, and met with a lot of veterans who have suffered these illnesses. We're doing a great job, but we're not doing enough. You know, we still have 17 suicides in veterans a day. What I would like to offer, and I would ask that people would actually also help support, you know, as a surgeon, I've used hyperbaric oxygen therapy for over 30 years to help treat wounds, wounds that need help healing. And I'm a firm believer that the science shows, you know, in part, that PTSD and traumatic brain injury come from wounds to the brain itself. The brain is an organ, just like your pancreas, just like your heart, just like your lung. And in these blast injuries, I do believe the brain is injured. And I think there's a mounting body of evidence. And as I'll say, as a physician, it's not 100% conclusive, but a mounting body of evidence that hyperbaric oxygen therapy can help some veterans get out of the trap that PTSD and TBI snares them into. Yes, we do have good treatments for them already, but we also have a fine line, a dead stop, a ceiling, if you will, when veterans really are not touched by other modalities. I have seen this make a life-changing difference in folks and veterans who have TBI, PTSD, who no other modality has helped. And I've submitted HR 1014 to ask that the veterans, the VA, really look at this issue as something that can be offered to our veterans on a large scale. It has been offered privately on veterans to a small scale. You know, we're trying to help. We're really needing to do everything physically possible to help the brave men and women who have dedicated and sacrificed so much to save our country. They come back, in some instances, changed individuals. And it is not only our duty, but it is our obligation to do whatever we can to help these individuals get their lives back and help them lead productive lives. So I'd ask that you all look at that and hopefully support HR 1014. Thank you, Mr. Chairman. My time is up. I will yield back.
Thank you, Dr. Murphy. I now call on a Representative Capter for 3 minutes. Representative Capter.
Thank you very much, Mr. Chair. And I think this is the first bicameral Zoom I participated in. I love it. Glad to work with our senators as well. And we want to thank Commander Whitehead so very much for your dedication and all of our service officers. I have two interests. One is in veterans housing, and the other one I'll follow on what Congressman Murphy just talked about, and that is brain injury and the functioning of the human brain in general, and the VA's research protocols. First, on veterans housing, I'm interested in your experience on that, particularly for the aging veteran, and experience you all may have around the country with how well or poorly the VA is integrating the need for veterans housing as veterans age with the HUD's program for VASH, as well as their 202 program, Shelter Plus Care. Number two, in terms of research on the brain, when I was first elected to Congress, I was absolutely astounded that the nearly $1 billion a year that the VA spends on research involve very few protocols that involve the human brain. I am wondering if this is something you follow as we deal with blast injuries, PTSD, behavioral health onset during service, and what more we could do working with you to increase those research protocols to study the human brain and its function. I know that Congresswoman Napolitano from California and I are heavily involved in understanding the human brain on some of the subcommittees that we work on. And I know that General Bergman is on the screen here, and I know he has a deep interest in this. I think we could really make a difference for the country working together. Thank you very much, and I'll wait for your replies.
Congresswoman, thank you for those questions. And if Joy, if you could elaborate on those two questions, I'd really appreciate it. Joy?
Very, very good question, especially with regarding the brain injuries and that lifetime of impact on veterans. One thing I think is interesting, we just saw VA was really looking to increase outreach regarding its brain bank. I'm not sure if you're familiar, but you know, that's some of the cutting edge critical research that VA is doing and why we support so much VA's research program. It's such a part of VA care, these unique injuries that occur to veterans who serve. So that's one critical issue, and we do follow that research, and we do look at all aspects, you know, access to the types of treatment that are available, compensation issues, but really that lifetime impact and how it impacts that veteran, and how what programs and services are necessary to really meet them at every step along their recovery process. Just very shortly on the HUD VASH program for homeless and veterans. Without question, VA has a homeless program second to none. They coordinate with HUD VASH. making sure housing first for veterans who are homeless, and that's a critical piece of it. We always bring up the issue of making sure that women veterans also have access to these programs. Sometimes housing issues, needs to be some sort of separation or access with the community for them because they may have their children with them. So we always want to make sure that a veteran doesn't miss out on a really important program that VA offers just because they may have the responsibility of caring for their children as well, and they have to coordinate with the community on that. But two excellent programs that VA is outstanding and out front on.
Thank you for the question, for the response, Ms. Elam, and thank you, Ms. Capter, for your interest in housing and in brain research. I just want to urge all members that we might want to take a bipartisan look at the research that's being done in Boston. That is where the collection of brains, this very large collection of brains exists, and it would be well for all of our committee members to understand the extent to which the VA invests in research. I now call on Representative Mann for 3 minutes. Representative Mann, are you present? If not, I will call on Representative Miller Meeks for 3 minutes. Representative Miller Meeks. Dr. Meeks.
Thank you so much, Chair Takano. I appreciate this. Thank you also to Commander Whitehead. As a fellow veteran, I appreciate all that our veteran service organizations do. And also, I continue to be a commission member of my county's Veterans Affairs Commission. So thank you very much for all that you do. Our county commission was very happy when the Blue Waters Act went through. And so and I think you made some reference to this earlier, my question or comments are in reference to the tremendous sacrifice all our veterans have made and putting themselves at risk, especially in times of war, but also how that carries over into peacetime. And we've mentioned toxic substances, burn pits, the legislation that we're hoping to get passed in a bipartisan fashion this year. And so my question is, utilizing the information we have from National Academies of Sciences and other research organizations onto environmental effects such as the burn pits, Agent Orange, that, should we have established a commission that would identify and be forward thinking in identifying toxic substances, pesticides, other things that exposure now or in the future could have adverse both physical and mental health adverse events upon our veterans, and they serve so that we do this in a proactive fashion rather than in a retroactive fashion. As all of us know, to get legislation passed to address these issues and be classified as a disability is an extraordinarily cumbersome process. So something that's looking more forward thinking to address these issues, I think might be helpful for our veterans. And
Congressman, thank you for such a great question. It's very important that we do look forward, and you're exactly right that we have to start looking in the future. We can't have our veterans that are currently serving or will be serving in the future having to wait as long as we have in the past for like Vietnam era veterans and stuff like that. But if my service director Jim can maybe elaborate a little bit more on the toxic exposure and stuff, Jim.
Yes, thanks, Commander. As I spoke earlier, I think we're in this situation because we don't have a great framework to establish presumptive conditions. And that's really what we need to concentrate on here. I mean, the hypertension, the 3 new presumptives that were added where VA has taken no action on yet. Just another perfect example of how we have to do better in improving the data collection. Like you had mentioned, forward thinking, establish a concession of exposure. That's why we're trying to, get legislation passed that will concede that exposure. So down the line, if they do develop a chronic illness as a result of that exposure, then it's that much easier to secure a medical opinion and have a claim process so they can get the benefits that they've earned based upon those exposures. So we have a lot of work to do, but we're certainly willing and want to work with you and your staff to make sure that that happens this year.
Dr. Milmix, I know your time is up. Now we move to Senator Hassan. Senator Hassan, you're recognized for 3 minutes.
Well, thank you very much, Mr. Chair, and I want to thank all the chairs and ranking members here today. And thank you to our witnesses for being here with us virtually today. I am deeply appreciative of your organization's service and advocacy on behalf of Granite State veterans and veterans all across the country. So to Mr. Whitehead, in your written testimony, you stated that 14 of the 20 veterans who die by suicide each day have not used VA health care services. In response to these numbers, the VA has established several programs to conduct outreach to transitioning veterans, including the Solid Start program, which aims to contact veterans 3 times during the first year of transition out of military service. Along with Senators Kramer and Cassidy, last Congress, I introduced the Solid Start Act to strengthen and codify this important program. I'll be reintroducing it shortly with some additional provisions. What else can the VA do to help veterans, especially newly separated veterans, connect to VA health services? And how can DAV and other veteran service organizations support these efforts?
Senator, excellent question, because as I stated earlier in my testimonial, any suicide is too many. One is too many, and we have to get out in front of this, and the VA has to take part of that. And I do appreciate them trying to make contact with our service members as you're transitioning from DoD to now the veterans into the private sector. But if Joy, if you can elaborate a little bit more on that, I'd greatly appreciate that.
Sure, just briefly, I would say that the Solid Start program, we're happy to see that going to be reintroduced, very important program. Having that connection right out of military service, whether it's through VA's outreach efforts, the veteran service organizations like DAV, the programs where we're right there making sure that veterans understand about the benefits and services that are available to them when they get out, connecting them with employment opportunities. I think 2 things though would be, the peer-to-peer programs that VA has started are essential because veterans really connect with other veterans well. And it's important that nobody gets lost and outside the system by themselves and trying to figure things out, that they've got a support system around them. And also, I think VA's public health model, we're really going to see this year, based on the legislation that was passed last year, 2 major public health model, suicide prevention, lots of provisions in there, and to see how those work with the connection with the community providers, to see veterans that haven't yet connected with VA. So both of those are going to be critical, and we have a number of programs in DAV through our Charitable Service Trust. One in Arkansas that we provided a significant grant to, where they're doing suicide prevention on a really local level. So those programs have to be explored as well.
Thank you very much. Thank you, Mr. Chair.
Thank you, Senator Hassan. I now call on Representative Underwood for 3 minutes. Representative Underwood.
Well, thank you. I'd like to thank the witnesses for being here with us. I am so delighted to be returning back to the Veterans Affairs Committee for another round of these conversations with our VSO groups. The work that you do around our communities has been extraordinary, and I personally am so grateful that you have come once again to offer some recommendations to our committee. I look forward to working with you on issues related to suicide prevention and improving the quality of care extended to our women veterans, and would invite you to offer any specific remarks that you would have on either area, if anybody had anything that they'd like to offer.
Thank you for that question. Joy, would you like to add anything to that?
Sure. Maybe just connecting both of those issues on women veterans and suicide prevention as well. We want to make sure that our women veterans have the services that they need. Oftentimes, though, they have to get that care in the community, and we think it's essential as more access to community care is available to women veterans and veterans in general. We need to make sure that the providers in that community care network are meeting the same standards as quality standards as are required by VA, whether that's in mental health or just in their primary care, that they understand military culture and that they also understand conditions that are common among veterans. For example, military sexual trauma or PTSD, other things that really may come up during their visit. They may need to have trauma-informed care, or if the veteran notes that they're homeless or about to be homeless, we want to have them connect back with VA and those supportive service VA offers. So I think that would be an important point, that care coordination piece.
Well, thank you for those comments. I certainly agree that care coordination is key, and I hope that as we continue to make it more robust, particularly, for example, in an area that I work a lot in, maternal health, that we'll be able to end the disparities that we see not only in our country, but within the veteran population. And I do hope that this committee will fully consider our Protecting Moms Who Served Act. Thank you all again for appearing before us today. Thank you to the chairman for the time, and I yield back.
Thank you, Ms. Underwood. I now call upon Representative Cawthorn for 3 minutes. Representative Cawthorn. Mr. Cawthorn doesn't look to be present currently. Let's then go to Mr. Nels. Mr. Nels, you're recognized for 3 minutes.
Thank you, Chairman. And my question, Commander Whitehead, thank you for what you do, and everyone else, honestly, for what we do for Americans veterans. I spent 22 years in the reserve and retired in 2009. But my question more is geared towards the veterans that have or are experiencing a difficult time since they leave service. Many of them are obviously with our economy the way it is, not being able to find decent employment. Those that are having a difficult time readjusting back into civilian life, having difficult times with their family, whether it's their spouse or their children, because they have PTSD. There's a plethora of issues that our veterans are facing, even with the COVID. And so I'm more talking about those veterans that end up in our criminal justice system. And my question would be is do you feel, Mr. Whitehead, that our nation, our criminal justice system, the individual states are addressing our veterans' needs, those that find themselves on the wrong side of the law? I know we have veterans courts in some states, but what are we doing to try to help those veterans that are being held in our county jails for crimes and different things, nonviolent crimes, as it relates to just them trying to find a way to get readjusted back in the civilian world?
Thank you for such an important topic, because you're right. The transition from service to coming to the community, and this criminal justice is part of that as well. Making sure that all of our veterans get due process here. Joy, can you elaborate a little bit more on that? What he's talking about?
Yes, the treatment courts have been very successful, and DAV's been very supportive of them, especially that since we know that many veterans who end up if they have the fortune to be in a state that does have that availability, it often comes to light that they really needed treatment, that they had an undiagnosed traumatic brain injury, they had undiagnosed PTSD, or they weren't getting treatment for a condition that really impacted their judgment and ended them up in having a legal issue. So that's critical. And again, this is where our veteran service organizations really come to play to try to guide those veterans that we see, that we try to help every day. If there's a problem, to really reach out to them to make that transition, to take advantage of all the programs and services that VA has. They have expertise like no one else on these transition issues, and that's what they're there for. But sometimes they get lost out there without that support. So we try to make sure that we do that, to continue that and pass that information on to others that really need the care.
Well, thank you, Joy, for the information. I say that because I've been a sheriff for 8 years, and we have many people in our jail, veterans, and they just seem to get lost, and there's no one out there advocating for them. So as long as our VSOs are out there trying to help those and make sure that they get some good legal representation, because they need to truly understand the issues that they're dealing with to help them be successful members in our society. So thank you for your work.
Thank you, Representative. I now recognize Representative Cawthorn for 3 minutes. Representative?
Chairman Takano, thank you very much. And to all of our witnesses, thank you for bringing your expert opinions to light here. It really does shed a lot of light on questions that I personally had. Thank you for all the questions that have come before mine. But Mr. Whitehead, I wanted to ask, our committees are considering legislation that will provide eligible veterans with up to 1 year of GI Bill style benefits to help the unemployed veterans in our country really retain retrain in another specialty and help those that are unemployed find gainful employment in the post-COVID-19 economy. Could you please elaborate how this rapid retraining program could help unemployed veterans get back on their feet?
Representative, that's an excellent question. The employment piece is very important, and the GI Bill is very important to every one of us. Jim, if you could elaborate a little bit more on that, I'd greatly appreciate it. Jim?
Yes, thank you, Commander. Obviously, we strongly support that. We think it's critical for veterans to be able to get back in the workforce in a quick manner. We've seen it firsthand during the pandemic. DAV stood up a relief program where we were able to provide over $2 million in relief to veterans who have either lost employment or lost a significant amount of income due to the pandemic. So we know that there are plenty of veterans out there affected by this. So anything that we can do to get them back into the workforce and a competitive workforce, we would support.
Thank you very much for your answer. That really does mean a lot. And I yield back.
Representative Cawthorn yields back. I just want to ask if there's any other representative or senator present that would like to have a chance to to speak or ask the DAV any questions. If not, I will move to the second panel.
Chairman Takano, this is Representative Luria. I would love the opportunity to ask a question.
Okay, Representative Luria, you're recognized for 3 minutes.
Thank you, Chairman Takano, and I want to thank our witnesses for joining us today. As the chair of the Disability Assistance and Memorial Affairs Subcommittee, our subcommittee plans to focus our efforts this Congress on some of the toxic exposure issues that have not been fully addressed. That includes burn pits for veterans who served in Southwest Asia, Iraq, Afghanistan, and other toxic exposure issues. I wonder if you could just comment, on the importance of this to your members, and if there's any specific areas within toxic exposures that you feel have been overlooked in previous Congresses that we should focus our efforts on as well.
Congresswoman, thank you for that. Such an important topic. Jim, if you could elaborate a little bit more on the toxic piece, I would greatly appreciate it.
Thank you, Commander. And great question. As I mentioned before, DAV is concerned and always concerned when veterans are exposed to toxins or environmental hazards during their military service. VA needs to be equipped to provide health care and service-connected benefits for those exposures. I talked a little bit about establishing a presumptive framework. I think that's very important. But also, I think Congress could enact some legislation to extend the 5-year period to VA health care for veterans who had exposure to burn pits. I think it's very important that they're able to get the health care right away. That's one of the most important pieces of it. And then establish entitlement to benefits after that as well. The concession of burn pit exposure, it wouldn't establish presumptive service connection, but it would remove the requirement for veterans having to prove their individual exposures. And I think that's something that we learned with Agent Orange and the exposure to Agent Orange, that you had to step foot on ground. That was a significant piece that you had to prove early on in the claims process. So I think if we address that now, that's certainly a right step in the right direction.
Great. Well, thank you for the feedback on that issue. And another issue that is very difficult for veterans to claim is those people who've unfortunately been victims of military sexual trauma during their service. And I know that we hear a lot from veterans and veterans advocates that there's a lot of ways to improve this process and make it better for people trying to seek help with those types of claims. I wonder if you could comment, from your membership, if there's anything that you've heard on that topic that would be helpful for us in helping veterans.
Yes, thank you. A very sensitive topic, and the more outreach we can do in encouraging these veterans that come forward who experience something that traumatic, we want to make sure that they're getting the health care and any benefits they're eligible for. And we want to do that in the best way possible for them. So we got to make it an easy process for them to be able to come forward where they're comfortable doing so as well. So anything we can do there. And again, I think it's more about the outreach piece, letting them know that we are here to help. There are folks that can help you. We want to talk to you. We want to help you any way we can.
Well, thank you, and thank you for those helpful suggestions. And again, thank you for the work that you do every day on behalf of our veterans. And I yield back.
Yes.
Oh, I'm sorry. Joy, did you want to add something as well? Please go ahead.
Ms. Allen, do you
Mr.
want to?
Chairman, it's Senator Blackburn. I would like to get a question in, if I may.
Senator Blackburn, I have you on my list, but Senator Bozeman is ahead of you in seniority, so I'm going to call on him. If there's if there's no other response to Ms. Luria, she did have a little bit of time left, I will move on. Thank you, Ms. Luria. Thank you, Representative Luria, for your questions. Thank you for your work on toxic exposure as chair of the DAMA subcommittee. I now call on Senator Bozeman for 3 minutes. Senator.
I appreciate that, and I really enjoyed the discussion.
Senator, I just want to make sure that the sound is okay. It sounds low to me. Can we make sure our technicians, can we fix the sound on Senator Bozeman?
Can you hear me okay now?
It still is faint. It's still low.
I will try and speak really loud. Is that better?
It's a little better. I guess we'll proceed. Go ahead, sir.
Why don't you go ahead to Senator Blackburn then?
Okay, and we'll come back. All right.
Yeah.
So, Senator Blackburn, while we're figuring out what's going on with Senator Bozeman's sound, why don't you go ahead and ask your questions?
Yes, I wanted to follow up on the toxic exposure issue. I had a question about the K2 veterans and legislation that I had that we were able to get through parts of it last year. And then President Trump issued an executive order handling much of what we needed around the K2 veterans. This really affects some of the 5th group out of Fort Campbell, the 160th, and people that are constituents of ours in Tennessee. So I would like for you to comment on the K2 veterans and what you are hearing from them as it relates to the hazards, the chemical hazards, the exposure, the risk that this has to their health.
Senator, thank you for that question. And Jim, if you could elaborate a little bit more on that K2, that'd be great. Jim?
Thanks, Commander. DAV fully supports the K2 Veterans Care Act as it will provide healthcare eligibility and establish a framework for presumptive diseases that obviously could lead to benefits for these veterans. As we know, and as you mentioned, there's a lot of veterans. There's up to 15,000 service members that were deployed to the K2 Air Base. So it's very important that we get it right now to ensure that they're taken care of. I haven't spoken to any one of our members who've been personally exposed on that particular base, but we know, again, 15,000 veterans were. So it's important that we do whatever we can to ensure that they are taken care of if they develop any illnesses associated with those exposures.
Okay, thank you.
You still have time left. Senator, if there's no other questions, I'll move on to Senator Bozeman and see if we have Senator Bozeman's sound fixed. Senator Bozeman, you're recognized.
Can you hear me now?
Yes, a lot better, Senator. Go ahead.
Oh, good. Very good. Technological difficulties. Again, in the interest of time, I've really enjoyed the discussion and just want to thank you all so much. I want to give a big shout out to the group in Arkansas that does such a great job of keeping me informed, and I think all of us holding our feet to the fire We've really accomplished a lot in the last several years, but we simply wouldn't have done that without the leadership of you all being the leaders of your organization, but also the grassroots in places like Arkansas that have really stepped forward and helped us understand what the needs are. And the good news is, in a very bipartisan way, I'm so proud of my Senate colleagues, and also having served in the House and being on Veterans Affairs there. Again, just working in a way that we've really gotten a lot done. We've got a lot left to do. My dad did 23 years in the Air Force, and I'm very proud of his service. I understand these are family affairs. And the other thing that's so important is that, these are not give-me's, these are earned benefits. And again, so just a big thank you to you and your membership. We simply would not be able to get the things done that we get done without your leadership. So give yourselves a pat on the back. And as always, a big thanks to the auxiliary. We know who does all the work. And so we really do appreciate them and all that they represent. So thank you, Mr. Chairman.
Thank you, Senator Bozeman. I understand that Representative Mann was with us by telephone, has no video, but would like to ask questions. Since this is not an official hearing, we can depart from our normal requirement that the video be turned on. So Representative Mann, go ahead for your questions. Representative Mann, are you able to unmute yourself? Let me see if the staff can. Stand by for just a little longer. Representative Mann.
Oh. Yeah. Chairman Takano, can you hear me now? Chairman Takano.
I can't hear you, Representative Mann. Are you ready to go?
I am. Yeah, you can hear me okay? Sorry, sir.
I can.
Well, thank you for letting me on. Thank you for being here to testify today. Really, my question, I know that Senator Tuberville touched on this as well, but for me, it's an honor to serve on the House Veterans Affairs Committee. I often tell people back home, this really should be called the Heroes Committee, and I'm glad to be here advocating for our men and women who wore the uniform. Our service members, as they transition to civilian life, often bring to the workforce unique skill sets and backgrounds and perspective. And I guess my question is, how can Congress improve the transition assistance program to better serve disabled service members in their transition to civil life? I know, like I said, Senator Tuberville also mentioned the transition, but specifically on the transition assistance program. What are the things that we could be doing to help our brave men and women when they return home, enter the workforce, and have a good career thereafter?
Thank you for such a great question, because that transition is critical. Getting in front of them right away is the most important thing, so they actually can have the soldier, now veteran, now has an idea of what they want to do. But Jim, if you could elaborate a little bit more on some of the areas that we could get after, that'd be great. Jim?
Thank you, Commander. We certainly agree that it's a significant process when you transition out of the military, and then finding employment after is so critical. The DAV was able to still interview with the pandemic 21,000 departing service members last year and assist them with the initial claims process. I think being able to continue to outreach to these individuals, letting them know that there are benefits, there are services available to you to help you with this transition is significant. I also think making sure that service members are required to go through these out processing briefings. We call them TAP classes as I was getting out of the military. And it was very beneficial to me, teaching you how to write a resume, where you can look for government jobs. All these resources need to be available, and it's got to be done in a consistent manner as well, regardless of where you're transitioning from. We hear that there's differences all over the place, and it can't be like that. It has to be consistent everywhere, and we got to provide those services even after you're discharged. You still want to have those services available to departing service members. I think a big piece, including spouses of service members, is important as well. It is a team effort, obviously, so we want to make sure that everybody's participating and taking advantage of those opportunities.
Yeah. How many, you said it'd be good if all of them participated? Rough ballpark, do the majority participate in something like that, or is there only a handful, or do we have any data on that?
I don't offhand. I know it is the majority. I mean, we would be happy to research that a little bit and follow up with you and your staff.
Okay, we can reach out, and I yield back. Thank you, Mr. Chairman.
Thank you, Representative Mann. That completes the questioning of this panel. I'd like to thank Commander Whitehead and the other witnesses from Disabled American Veterans. We appreciate hearing from you today and look forward to working together with you during this Congress. You are now excused. We will move immediately into the second panel. I now call up our second panel. And we have with us today on our second panel, Dr. Thomas A. Zampieri, National President of the Blinded Veterans Association, BVA, Mr. John Hilgert, President of the National Association of State Directors of Veterans Affairs, Mr. Corey Titus, Director, Government Relations for Veterans Benefits of the Military Officers Association of America, otherwise known as MOA, Mr. Jared Lyon, National President and CEO of Student Veterans of America, SVA, Ms. Lindsley Church, Executive Director, Co-founder of Minority Veterans of America, and Ms. Catherine Monet, Chief Executive Officer, National Coalition of Homeless Veterans, or NCHV. I now call on Dr. Zampieri for your testimony. You're recognized for 5 minutes to present your opening statement.
Thank you to Chairman Takano and all the members of the committee for inviting the Blinded Veterans Association to testify before you today. I'll quickly run through some of the major issues that the BVA has a lot of details in our testimony. And hopefully you and the members and staff will go through those closely. We request, along with the PVA, that for catastrophically disabled service-connected veterans, that the auto grant be renewable every 10 years. We also ask that you continue your support for women's veterans, and we endorse the section of the VSO independent budget section that addresses some of those issues. We're concerned about, of course, as the DAV touched on, the caregiver delays in the implementation of the caregiver program for our older veterans, especially who suffer from not only their service-connected disabilities, but aging-related disabilities. It makes it even harder for the caregivers to have to wait longer for that. We do ask that you consider working closely with the BVA, our government relations staff, on an area that has grown increasingly a concern to us, and that's with guide dogs and service dogs on VA properties. There's been increasing incidences of assault by other types of dogs, where guide dogs and blind veterans have actually been physically assaulted by some types of other therapy dogs. And we've got 76 years of experience in working with guide dogs and service dogs. And we would respectfully request that before the committee takes action on any specific bills in regards to how the VA should be addressing these issues, that you include us. We also are concerned about staffing and funding within blind rehabilitation services. With the COVID shutdown, the blind centers went virtual, and as other medical services have had to make that dramatic shift, what we've been concerned about is they're not replacing staff, though, existing staff in those blind rehab centers. And we would point to Public Law 114-223, which has a requirement for staffing for special rehabilitative programs, not just blind, but spinal cord also, and the funding for those programs. For those of you who serve on both the VA and the DoD world, Armed Services, I've got 3 issues that really would like your attention. One is may be under the radar screen, sort of, but we were excited last September 29th, the Assistant Secretary of Defense for Health Affairs and the Surgeon General of the UK established a formal agreement to have an international joint ocular trauma task group. And they have formed it with a couple chairmen who are ophthalmologists, highly experienced, combat experienced ophthalmologists. And there's as many as 15 other representatives on this task group. And lo and behold, now the problem is they have no money. You can imagine. So just to let you know how much interest there is, the Surgeon General of the UK personally told me that there's at least 6 other countries that want to engage with this because eye injuries are such a significant portion of all casualties. So Israel, Germany, Canada, Australia, just to name a few. But how do you have an international trauma task group with no funding and no administrative support? So that probably would only take about a phone call from one of you listening to this today. And if someone says how much other task groups have had $1 million in funding, that's not a really huge dent over there at the Assistant Secretary of Defense's office, I don't think. The NDAA of 2017, along with that, mandated that they designate 4 specialty centers for things such as TBI, limb injuries, burns, etc. When Congress put the language into the NDAA in 2017, here we are in 2021, and DHA has failed to designate 4 ocular trauma centers of excellence. Those are critical because, as any of you that have been involved in the polytrauma centers, if you don't have the full complement of the specialists in eye trauma, corneal specialists, retinal specialists, neuro-ophthalmologists, you can't treat these patients if they get sent to a smaller MTF. So that's an oversight issue. The Congressionally Directed Medical Research Program includes the Vision Research Program. It is the only source in the United States of funding for ocular trauma research. We're asking BVA, and other VSOs have supported this in the past, $30 million for the VRP program. I actually sit on the VRP Programmatic Peer Review Committee, and we have 81 full grant applications this year. With the 20 million that we currently have, we'll be lucky if we can fund 14 or 15 of those. The VA doesn't fund ocular trauma research. Why should they? They do rehabilitation of eye injuries. DoD, much to our frustration, is just eliminated and consolidated a lot of their deployment medical research programs into and a lot of abbreviations, but now there's no core internal DoD eye trauma funding.
Mr. Zampieri, I'm going to have to ask you to kind of conclude.
Yes,
We've got a panel to go through.
Yep, thank you very much for inviting me to testify today, and be glad to answer any of your questions.
Thank you, Mr. Zampieri. I appreciate your testimony. You'll be happy to know that we have an ophthalmologist who actually is on our committee. So,
wow.
Dr. Miller Meeks of Iowa. Mr. Hilgert, I now recognize Mr. Hilgert, I now recognize you for 5 minutes to present your opening statement. I'm sorry, Mr. Hilgert, your sound is not working. Let's give our sound technicians a chance to get your sound to turn on. Maybe make sure that you're turned off of mute. Can you try again? Mr. Hilgert? Still no sound. Still no sound. All right, we might have to move on to the next witness and then come back to you, Mr. Hilgert. Let's see if Mr. Titus, if your sound is working. Mr. Titus?
Yes, Chairman, thank you.
Well, go ahead for 5 minutes, sir.
Okay, thank you. Thank you, Chairman Tester. Thank you, and Chairman Takano, ranking members Moran and Bost, and committee members. Thank you for the opportunity to share Mo's legislative priorities for veterans. Just over 3 years ago, I took off my Army uniform and started my journey as a civilian. I received my first service-connected disability payment within a couple of months of separation. I went back to school using my post-9/11 GI Bill benefits, and I used the VA for my healthcare, both at the DC Medical Center and in the community. My experience thus far has been the VA at its best. However, not all have enjoyed the same care as I. Most members, soldiers I served with, and even members of my family haven't had the same experience. We need to keep on going and create equity for all veterans to enjoy the same quality experience and access to benefits and care, regardless of their gender, race, location, or generation of service. That goal of continuing to build on past progress is the intent behind MOA's top legislative priorities for veterans. 4 high-interest items include implementing COVID lessons learned, overseeing the implementation of suicide prevention and behavioral health legislation, supporting women and minority veterans, and enacting comprehensive toxic exposure reform. With the 3rd vaccine now approved for emergency use, optimism continues to grow as an end to the pandemic seems near. VA quickly moved to expand the VA workforce to meet the health crisis, one of many positive steps. However, vulnerabilities were also exposed, like in state veterans' homes and community living centers. MOA recommends VA examine every aspect of the COVID-19 response enterprise-wide. VA must conduct a thorough examination along a wide variety of demographics and apply lessons learned so that it can improve support to veterans. The 116th Congress passed many landmark bills to address mental health needs and prevent suicide. Congress's oversight is essential as VA implements these in an effective manner. The pandemic has only made it more challenging for veterans to engage with VHA. Much has been done to mitigate the risks of spreading the virus, like expanding telehealth and telemental health services, but more is needed to stem the tide and mitigate the rising rates of mental health diagnoses and suicides. MOA recommends stringent oversight of veteran suicide prevention and behavioral health programs, and ensuring full implementation of the bill as Congress intended. Women transitioning out of uniform face multiple challenges because of their experience in service. While VA has implemented a comprehensive primary care model for women, there remain several barriers to getting the care and services they need. Additionally, according to GAO, the VA has taken steps to reduce the disparities in health outcomes linked to race and ethnicity, but lacks the mechanisms to measure progress and ensure accountability. MOA recommends eliminating health disparities for women and minority veterans to assure timely access to compassionate, quality care. And a few weeks ago, Major Richard Starr lost his fight with metastatic lung cancer. Major Starr spent his final days fighting the injustice of concurrent receipt, and I ask each of you to support his namesake bill. But I also raise this story to remind us that the challenges facing veterans are not isolated or singular in nature. Our military's use of burn pits is suspected as a factor in his death. Health issues compounded into veterans' benefits issues and vice versa. It's time to take a holistic approach in supporting challenges veterans face, like toxic exposures. MOA recommends passing comprehensive toxic exposure reform that helps veterans by enacting Senator Sullivan and Manchin's bill conceding exposure, expanding access to health care, and improving the reporting requirements of presumptive conditions to ensure they are helping veterans the way they are intended. I thank you for the opportunity to present MOA's priorities. We look forward to working together with the committees to build on the VA's progress to date and create equity for all veterans. Thank you, and I look forward to your questions.
Thank you, Mr. Titus. Mr. Hilgert, let's see if your sound is working. Mr. Hilgert? If not, Mr. Hilgert, let's move on to Mr. Lyon. Mr. Lyon, do you want to present your opening statement?
Yes, Mr. Chairman.
Go ahead. You're recognized for 5 minutes, sir.
Thank you, Chairman Takano and Chairman Tester, ranking members Moran and Bost, members of the committee. Thank you for inviting Student Veterans of America to testify on our policy priorities for 2021. With our mission focused on empowerment and inclusion, SVA is committed to providing an educational experience that goes beyond the classroom. Our goal is to inspire tomorrow's leaders. Our policy priorities come from direct interactions with student veterans. Over the past decade, we've also dedicated significant resources to researching the efficacy and the impact of the post 9/11 GI Bill. The purpose of our research has been to address a straightforward question. What is America getting for its multi-billion-dollar investment in education of veterans? The bottom line is this: student veterans are among the most successful students in all of higher education. With appropriate resources, this research could be updated annually to better address student veteran success. Take, for example, the SVA chapter at Clemson University. Over the course of the pandemic, their chapter leadership has worked closely with campus career service offices to promote the organizational virtual career fair and professional development courses. Clemson University is home to our 2021 Chapter of the Year Award, and they continue to inspire others with their adaptability and commitment to their community. Well, examples like Clemson are indeed special. They are not unique. Over this past year, student veterans nationwide have risen to the occasion, as they always have. Andrew Ho is an Air Force veteran at the University of Nevada, Las Vegas. He is a first-generation college student and an SVA chapter president on his campus. Andrew was selected from among thousands of his peers as our 2021 Student Veteran of the Year. And there are so many others with similarly impressive stories of success, service, and leadership. Student veterans have experienced unique frustrations and concerns throughout this past year. Between the pandemic impacting the community of education and a national reckoning on racial justice sparked by the death of George Floyd, SVA chapter leaders have risen to the occasion to lead through these most challenging times. Ensuring inclusivity in all that we do, especially for our sisters and brothers in arms, for the Black, Indigenous, people of color, LGBTQ communities, it will remain at the forefront of everything that we do. As it relates to the pandemic, even with these generous flexibilities created by this Congress and quick support from the VA, unlike their civilian counterparts, student veterans were nearly wholly dependent on schools accurately understanding the rapidly changing VA guidance when making decisions for their entire student populations. While not a whole fix, this is why one of our first legislative recommendations is to codify national emergency flexibilities for GI Bill students. This will allow schools and students to better plan for their future emergencies as they arise. As for the majority of our recommendations, based on what student veterans have told us in recent years and months, we are committed to our priorities having a central theme, and that is the GI Bill is the front door to the Department of Veterans Affairs. Typically, using the GI Bill is one of the first interactions that a newly transitioned veteran will have with the VA and the universe of post-service benefits and programs. This means that a seamless GI Bill process is key to establishing trust and confidence in VA. Much like the Veterans Health Administration's whole health concept for treating the entirety of a veteran, SV advocates for a whole benefits approach for modernizing VA education services. This idea is a big one, but it begins with perfecting all the small steps in the process along the way. With the overhaul of VBA's IT system now underway, VA can focus on continuing to improve customer service, expand communication, quickly respond to beneficiaries' questions, digitize eligibility certificates, reduce the lag between applying for benefits and receiving the first tuition and housing payments, and so much more. By truly embracing the GI Bill as the front door, we open up untold potential for VA to focus on making consistent early outreach with accurate contact information to establish a lifelong connection with the VA. The effects of treating the GI Bill as the front door to the VA will be felt immediately. At Student Veterans of America, we often say that veterans are the ambassadors for military service. Similarly, the quality of the VA service to student veterans is the ambassador for all VA services. We look forward to focusing on this concept as we work with our partners at the VA and our veteran advocate counterparts during the 117th Congress and beyond. Moving forward, the GI Bill as the front door to the VA mentality, we are hopeful that this Congress can focus on addressing some of the lingering basic needs of student veterans. For example, increasing access to childcare is a near universal conversation among SVA chapters. This should come as no surprise, considering that more than 50% of student veterans have children. We thank Chairman, ranking members, and the committee members for your time, attention, and devotion to the cause of veterans in higher education. As always, we welcome your feedback and questions. Thank you so much for inviting Student Veterans of America to testify today.
Thank you, Mr. Lyon. I now call upon is Mr. Hilgert still here? Mr. Hilgert?
Yes, sir.
It sounds like your sound is working. Like we can hear you. Go ahead. You're recognized for 5 minutes.
Thank
I
you. Yeah,
apologize.
No, you have very generous staff. They're very helpful. Thank you. Chairman Tester, Chairman Takano, Ranking Member Moran, Ranking Member Boss, and distinguished members of the committee. My name is John Hilgert. I am the president of the National Association of State Directors of Veterans Affairs, and I serve as director of the Nebraska Department of Veterans Affairs. NASDVA is comprised of state directors from every state and every territory. And in person, if we would have been in person, I would have been joined by John Skokos, our executive director, and also Tom Palladino, the executive director of the Texas Veterans Commission and the incoming president of our association. States and territories continue to increase their roles in holistic service providers to veterans. We coordinate, connect, we convene teams to address veteran employment, education, economic empowerment, and continued health, whole health and wellness. Despite constrained state budgets and the challenges of COVID-19, states collectively contribute over $10 billion each year to service in our nation's veterans and their families. NASDVA, through its member states and territories, is the single organization outside the federal VA that serves 19 million veterans. Given that, we are tasked and held accountable by our respective governors, our state boards, our commissions, who are well positioned to deliver effective and efficient and veteran-focused services. Regarding veterans' benefits and healthcare and services, we support the continued implementation of provisions of the VA Mission Act. The NASVA's priorities for the care of our veterans are consistent with those of the VA, especially in the area of behavioral health and suicide prevention. We support an all of the above strategy for healthcare delivery, which recognizes the diversity, the geography, and the demographic makeup of today's veterans. Regarding state veterans homes, the State Veterans Homes Construction Grant Program is one of the most important partnerships we have with the VA. COVID-19 has focused national attention on our state veterans homes. In Nebraska, I'm responsible for 4 state veterans homes. Given the number of state veterans homes, roughly 30% are not CMS certified. The VA may need to provide more support to state veterans homes when health measures are directed but unfunded to non-CMS homes. The VA may also consider defining a maintenance charge that covers in a state veterans homes relative to what specialty care the VA covers. And arguably, both the VA and state veterans homes have a role to provide mental health services. The challenge is delineating the cost of care associated with geriatric psychiatry. To be direct, NASVA would offer that the VA would allow mental health services to be deemed a specialty care service and not a basic service covered to be provided by the state veterans homes through their per diem allowance. This would allow the VA to provide desperately needed care resources to our veterans and state veterans homes. Additionally, the VA, with congressional support, could also consider changing the 70% service-connected disability provision for full state veterans home per diem from the to a 50% service-connected disability. This would provide a more important and immediate help for the care of our veterans in our state veterans homes. Despite all of the challenges of COVID-19, NASVA continues to support a commitment to the significant funding of the State Veterans Homes Construction Grant Program, roughly to increase the funding to at least $500 million. NASVA is encouraged by the committee's oversight and interest in examining and improving the VA support of our state veterans home. Please use NASVA as a resource to validate lessons learned, to test ideas, and to identify potential legislative changes. Here's an example. As the VA's Millennial Electronic Health Record is deployed, use the state of Washington to test consistency for the seamless delivery of quality care with the new rollout. Regarding veterans benefits, given the claims backlog, the number of claims on appeal, NASVA recommends serious consideration to make federal funding available to state veterans departments to assist with outreach efforts on the ground. We recommend funding and focus for VA adjudication in these claims, but beyond funding, the VA should offer more virtual training and accredited service officers. And finally, NASVA would like to emphasize the important role of the National Personnel Record Center in providing vital records, which is frankly the lifeblood of the system regarding our benefits advocacy. Regarding the VA funding, once released, NASVA would welcome the opportunity to review the details of the President's fiscal year 22 VA budget and would respond favorably to an invitation to comment on said budget at a later date. Women veterans, they comprise 20% of our armed forces at this point and are growing. We would strongly encourage that the VBA make the Women Veterans Coordinator a full-time role. Distinguished members of the committee, with your continued support, we can ensure to serve the needs of our veterans and their families. Use the state directors in your respective states as resources. Reach out to us. We're here to partner and we're here to support. We are a resource. Thank you very much for your time, and be more than happy to answer any questions.
Thank you, Mr. Hilgert. I now call on Ms. Church. Ms. Church, you are recognized for 5 minutes for your opening statement.
Chairman Takano and Tester, ranking members Bost and Moran, and distinguished members of the committee. My name is Lindsay Church, and I'm honored to serve as the executive director and co-founder of Minority Veterans of America, a nonprofit dedicated to creating community belonging and advancing equity for minority veterans. I served in the United States Navy as a Persian Farsi linguist before being medically retired. I'm the daughter of a woman veteran, the third generation in my family to serve, and one of the many queer veterans who served under Don't Ask, Don't Tell. I want to begin by thanking you for prioritizing the needs of minority veterans on these panels and for allowing us to contribute. MVA began as a movement in 2017 because many in the community felt unsafe and unwelcome in traditional veteran spaces and in VA care. We were founded by myself and Dr. Catherine Pratt, a Korean American woman veteran who struggled with similar challenges in the veteran community. We bonded over a deep recognition that though we may not understand each other's lived experiences, we both understand what it felt like to hold marginalized identities as veterans and to feel ostracized by the community solely because of these identities. In 3 years, our community has grown to over 2,200 members across 48 states, 3 territories, and 3 countries. In our work, we proudly represent the unique needs of veterans of color, women, LGBTQ, and religious minorities. Altogether, our membership accounts for tens of thousands of years of military service. I'm here today to testify from my own personal experiences, but also, and more importantly, to advocate on behalf of the millions of minority veterans whose needs and perspectives have only just begun to be heard by your committees. The priorities we submitted echo the experiences of many minority veterans who have been excluded from or underserved through existing frameworks, whether negligently or intentionally. In an era where our military is only growing increasingly more diverse, it is imperative that veteran services keep pace with these changes in order to better serve this generation of veterans and those who will soon join our ranks. As we look to the future of veteran services, we urge the committees to consider a mindset shift and to begin examining existing and potential systems and frameworks through a lens that centers and prioritizes the minority veteran. We have found a system where a system is designed to serve the most marginalized first, it will innately and more effectively serve those that experience more privilege. Within our written testimony, we highlighted several key areas that we are internally prioritizing and which we hope to work with your office to address. There are three key areas that I want to highlight this morning during these remarks. The first, addressing economic disparities. Minority veterans show up not with singular identities, but with intersecting and overlapping characteristics, the weight of which impacts and compounds many of the factors that we're proactively seeking to address. It is critically important that we begin looking towards positively impacting economic disparities within the veteran community through an intersectional and trauma-informed lens, especially as we re-examine the provision of GI Bill interval pay and equitable access to capital. The second point I would like to highlight is resolving systemic injustices for minority veterans. The recent murder of Specialist Vanessa Guillen and the continued incarceration of Corporal Tae highlight the need for urgent action to address a culture that is failing to adequately support our community. We must initiate comprehensive reviews and structural reforms to address the continuum of harm felt by military sexual trauma survivors. Fight to repatriate deported veterans, codify the military trans ban into law, and rename VFV facilities named after Confederate surgeons, eugenics movement leaders, and those believed to have been involved with Nazi sterilization efforts. Finally, addressing the healthcare disparities and creating a more equitable VA. As I mentioned previously, the nation's veteran population is only becoming more diverse by the generation. It is imperative that we design a 21st century VA that is inclusive of veterans and the many identities that we hold. We can begin to build this department by adopting a gender inclusive motto, ending the ban on gender affirmation surgery and abortion-related counseling and services, and expanding IVF and surrogacy program offerings to empower millions of minority veterans to begin family planning in the ways that make sense for them. We're at a moment, and we're at a moment in time where the VA and these committees have a real opportunity to regain the trust and confidence of minority veteran communities that have historically been excluded. We must take advantage of it, and we must begin looking towards development of programs and systems that were specifically designed to support our nation's most vulnerable veteran populations. I again thank you for the opportunity to testify today and look forward to continuing to work with you and your offices, and I'm happy to answer any questions that you might have.
Thank you, Ms. Church. I now call on Ms. Monet for her opening statement for 5 minutes.
Chairs Tester and Takano, Ranking Members Miranda and Boss, and the distinguished members of the Committees on Veterans Affairs, it's an honor to share NCHV's legislative priorities with you today. We thank you for your continued efforts to focus on the needs of this group of veterans. The assistance Congress provided since the pandemic has started has allowed NCHV member organizations across the country to keep veterans safe from COVID by social distancing in shelters, ramping up rapid rehousing capacity, and focusing on individualized housing options in communities across the country. While HUD has not yet released 2020 PIT count data, we know veteran homelessness decreased by 50% between 2010 and 2019, largely due to increased investment, adherence to evidence-based solutions, and dedicated coordination at the national and local level. We need to double down on what we know works to end veteran homelessness while simultaneously recalibrating the system to respond to the urgent economic crisis COVID has created and inequities that certain veteran groups face. Homelessness is complex, thus a variety of tools from both inside and outside VA are required to respond to individual crises and needs. We have 4 priorities to put forth today. Priority 1 is COVID crisis response. Homelessness can make veterans more vulnerable to COVID-19. VA's reporting offers no clear way to determine how many reported patients are experiencing homelessness. Adding the status it's reporting on confirmed COVID cases and deaths like DC, New York City, and other jurisdictions do would improve risk assessments and the ability to create a comprehensive local response. VA must continue to address veteran homelessness within the greater scale of the COVID-19 response by including by creation of a national standard prioritizing testing and vaccination for veterans who are unsheltered or living in more congregate settings and all who reside there with them. We ask Congress to direct VA to utilize its humanitarian care authority during the duration of the pandemic to provide easily accessible COVID-related health and preventive care to all veterans experiencing homelessness, regardless of discharge status or time in service. Access to both has varied widely across the country. Our priority 2 is COVID recovery. NCHV supports funding increases for key programs to address veteran homelessness and an increase in the daily grant and per diem rate. As our country moves out of a crisis response phase and into a COVID recovery phase, we also need to focus on meeting the imminent needs of veterans and the creation of substantially more affordable and supportive housing. Nearly 15 million Americans have accrued over $50 billion in missed rental payments during the course of this pandemic. Veterans are among them and need to be connected to emergency rental assistance and other benefits for stability. We appreciate the inclusion of homeless veterans in the Senate substitute amendment for the American Rescue Plan, and we know that economic recovery will take time. Employment and training opportunities will be critical to ensure that people can get back on their feet, and DOL's HVRP program is a key resource for veterans who are homeless or at risk. We ask Congress to prioritize its expansion through 2023 as a part of any recovery package. My written testimony has detailed recommendations for $1.6 billion in emergency appropriations to support veterans experiencing and at risk of homelessness. Notably, this funding would allow federal partners to continue or expand essential services such as social distancing in congregate facilities, renovations to create safety, expansion of SSVS shallow subsidy program, and funding for VA case managers for unutilized HUD-VASH vouchers. Some communities are purchasing hotels and motels for conversion to supportive housing, and capital dollars paired with project-based vouchers could increase availability of affordable housing rapidly. Our priority 3 is equity. Programs to serve unhoused veterans must focus on racial and other types of equity to ensure we're not leaving anyone behind. Black veterans are vastly overrepresented in the homeless population. Native Hawaiian and Pacific Islander veterans are most likely to become homeless. Transgender veterans are 3 times more likely to experience homelessness than non-trans veterans, and women veterans are among the fastest growing groups within this population. VA needs to look at ways to foster equitable treatment of veterans who utilize homeless services. They need to work to unearth inequities in homeless adjacent systems to address the root causes. And most importantly, they need to create a space where all veterans feel comfortable accessing care. Our 4th priority is housing affordability, which affects both veterans and civilians alike. It is beyond time for housing to be considered a right in this country. The average rental price, according to HUD, has increased by 66% between 2010 and 2020. Yet, the federal minimum wage has remained unadjusted since 2009. A livable wage offers the dignity of being able to afford the minimum basics needed to survive. And in 2019, over 660,000 veterans were paying more than 50% of their income in rent. You can make meaningful progress toward ending homelessness for all by increasing the minimum wage or making it right with subsidies for all who need them. Thank you for the opportunity to speak with you today. It's a privilege to work with all of you and your staff members on ending veteran homelessness.
Thank you very much, Ms. Monet. I'm now going to call myself and then the ranking member for questions. I'll see if I can get Mr. Moran, Senator Moran, in before we actually take a recess for 10 minutes. But so let me get started with my questions. I recognize myself for 3 minutes. And we'll need to take a recess because the House is voting. So,
Mr. Chairman, I'm here.
Mr. Moran,
Yes.
thank you. I'm going to call myself and then Mr. Boss and then you, and then we'll take a 10-minute recess. The House is voting, so I got to give members a chance to go and vote. But it'll be a strict 10 minutes. So I'll recognize myself for 3 minutes. Mr. Lyon of SVA, as you mentioned in your testimony, it appears that VA will be ending the rounding out this summer. Do you have data on how many students take advantage of this practice?
Yes, Mr. Chairman, thank you so very much for the question. Our research and data currently indicate approximately 25% of GI Bill users are impacted by this policy.
Great. I support your desire for a 4th administration for economic opportunity in VA. How have education programs suffered due to the current structure of VA leadership?
Yes, Mr. Chairman, I really do appreciate this question because presently VA is doing a great job. They're trying really hard, and this Congress has done a phenomenal job of instituting the right kinds of policies and in such an expedient manner that it's almost unbelievable. That all said, these gains can easily be lost without the permanent establishment of a 4th administration to ensure within the structure of the Department of Veterans Affairs that these matters are codified and paid attention to on a regular basis so that we can always ensure this level of care to our nation's student veterans.
Thank you for that. Let me go to Ms. Ms. Church. Ms. Church, in your testimony, you highlight the need for access to capital for veteran and minority-owned businesses. As we work to strengthen veteran and minority-owned veteran access to capital, what do you propose Congress can do to assist with increasing access?
Thank you for the question, sir. One of the greatest things that Congress can do is find programs and ways to allow minority veterans access to capital. We know there's a deep wage and wealth gap for minority veterans, specifically BIPOC veterans and LGBTQ folks specifically. So in recognition of that, finding ways to fund and set aside subsidies and programs to be able to support minority veteran entrepreneurship, as well as invest in programs and different nonprofits and organizations that are able to support minority veteran entrepreneurship and support them with their identities and everything that's included in being a minority entrepreneur.
Great. We all want to continue to make VA a more inclusive and equitable place for all veterans. And as you've mentioned in your testimony, the need to address sexual harassment and investigation response procedures is of great importance. Beyond the review of programs, what else should Congress do to help change the way women and non-binary people are treated at VA facilities?
Thank you for that question as well. We do believe that a comprehensive review of the structures and reporting for sexual assault and sexual harassment needs to be done. We watched the appalling treatment of one of your own staffers in the last under the last administration. So I think one of the biggest things that VA has to do is build trust. Even if the mechanisms are in place, people don't trust them. So we need to be able to figure out ways to support those survivors and being able to report and find justice and accountability, and for that perpetrator not to be continued, so it be allowed to exist in those spaces.
That's great. Thank you. I want to quickly move to Ranking Member Boss so he can ask questions. Ranking Member Boss, go ahead.
Thank you, Chairman. One of the questions that I asked the first panel is one I would just to ask the panel here. I mentioned the fact that Chairman Takano and I have introduced the Vaccine Act, and this will expand the access to vaccine to all veterans and the caregivers of those who are certain long-term or home-based caregiver programs. Would your organizations be in support of the bill, and why or why not? Whoever wants to speak up.
Well, certainly we would, the National Association of State Directors of Veterans Homes would be certainly supportive of that. And it's interesting that you talk about caregivers and veterans. And I would reflect on perhaps a little bit more study on how veterans homes are connected to this whole system. We're built by the VA. We're funded by the VA through the per diem program. They inspect us inside and out on an annual basis and as need be basis. But yet when it comes time to vaccine for not only our members and some of their spouses that live within our homes, their caregivers, our teammates, our staff are then shifted to the non-VA sector, and through the federal program that was successful, the 3 visits, CVS, Walgreens, et cetera, that went through the nation, but we were treated as other nursing homes. So that's helpful, but point forward, it would be nice to establish a relationship with the VA that our new employees, our new admissions, our new spouse, the new people that come into the veterans homes after that initial wave could develop a relationship with the US VA that's frankly beyond their 4th mission and back into their fundamental mission of supporting our veterans. That would be welcome, sir.
Well, and I appreciate that. And another question I just want to throw out. One of my priorities is for strengthening the services for women veterans at our VA hospitals. I know, Ms. Church, that you actually responded on the sexual harassment side and everything like that, and I heard that comment. But what other areas where women are maybe being underserved need to be addressed as far as the VA is?
Thank you for that question. I think one of the greatest areas of improvement that we have for women veterans is around reproductive care, whether it be access to abortion and contraceptives or to family planning. I think that the reproductive care should match where the veteran is and what they're looking for their family planning. We know that an unwanted or unplanned pregnancy can drop somebody into a cycle of poverty that they'll never recover from. So effective and safe measures of family planning are going to be the biggest area of opportunity VA has as far as women veterans go.
And thank you. My time has expired. And with that, Mr. Chairman, I'll yield back.
Thank you, Ranking Member Bost. Ranking Member Moran, I want to call on you before we recess. Go ahead.
Thank you, Chairman, for doing that, and I'll be brief to keep you on schedule. Let me just ask all of our witnesses that any who have thoughts, let me make it specific, but it's really a broader question than it will sound. What is it that I can do as an individual member of Congress in Kansas to make sure that veterans are getting the vaccine that they need? Certainly support the concept of Representative Bost, Ranking Member Bost, in caregivers, spouses, and others. But what's missing? And how do you think the VA is doing? Are we getting this goal accomplished?
Sir, I don't mind taking that. Thanks so much for the question. I think that you specifically as a member of Congress can continue what you're doing with regard to encouragement, but to also provide more access. Student Veterans of America has partnered with a bunch of our fellow veteran service organizations through what we call the Veterans Coalition and Vaccines to actually mobilize veterans to help inoculate the population. We're only as effective to getting back to normal as when we actually get shots in arms. So you as a member of Congress could help elevate that throughout veterans in your state to literally let them know that they can start volunteering to be part of this solution, sir. Thank you.
Thank you. Thank you, Jared, very much.
And then Senator.
I'd like to add to that.
I'm going to let you go, Catherine. You're up. Sorry.
Well, I'll be real quick. So I'd like to add to that and just note that some of the issues that we're seeing with homeless veterans mirror the issues that Mr. Hilgert raised with state veterans homes. And in some communities, people experiencing homelessness and shelter providers have actually been prioritized for the vaccine because of the congregate settings and the high risk of transmission. So I think I'd encourage you to make sure that your solutions are all encompassing and provide some level of equity for people who are highly underserved.
Catherine, thank you for the reminder. When I last visited a vaccine site at the Topeka VA, the Comer O'Neill VA, I did ask the question, how are we taking care of homeless veterans in this area? And I'll continue to do that. Thank you.
Sir, if I might add as well, one of the things that I think is very important as we talk about vaccine distribution is equitability and meeting folks where they are. We know that that there's been a disproportionate, specifically by race, distribution of vaccines. So for us, it's a deep concern, echoing Catherine's remarks about veterans experiencing homelessness and ensuring that those folks are getting vaccinated first because they're the ones that are more likely to be around other folks. Additionally, working with tribal, I know that there's a lot of folks within your community that live on indigenous populations or lands, and ensuring that those folks who have low access to care in general have greater access to vaccines because they've been hit the hardest. So I think the biggest thing that you can do, sir, to be a champion for vaccines when it comes to veterans is really ensuring that you're hitting those populations that are, one, more likely to be contracting COVID, and two, less likely to have access to healthcare.
Thank you for the reminder, and thank you for caring for all veterans.
Senator Moran, thank you for your questions, and thank you for your forbearance with us in the House. I'm going to declare a 10-minute recess, upon which we will return and Mr. Mervan will begin the questioning. And panelists, I apologize, but we do have to go and vote. So a 10-minute recess, and we'll be back in 10 minutes. I now recognize Mr. Mervan for his 3 minutes. Mr. Mervan, go ahead.
Thank you very much, and I thank you, Chairman Takano. I appreciate everyone's patience, and I appreciate all that you do for veterans, and we want to welcome you to the Veteran Affairs Committee today. My question has to do with the digital divide. Recently, there's been a lot of coverage about the digital divide, specifically the lack of broadband internet, especially in rural America and older urban America, and how it has disadvantaged people who live in those communities. My subcommittee, the Subcommittee on Technology and Modernization, is planning on taking a comprehensive look at the digital divide and how the VA is working to bridge it. Ms. Church, or anyone, can you talk about how the digital divide or lack of access to the internet and technology impacts minority communities, even those in urban areas? And do you have thoughts on ways the VA can address these gaps?
Thank you so much for the question. And the digital divide has in a world in which we turned everything digital, including our healthcare, our schools, our work, internet has become more than just it's a staple of society anymore. It's a utility. And we're seeing the boundaries and limits of that being tested every single day. In communities that have lower socioeconomic status, it's more often that the broadband itself is actually poor. In addition, when you don't have technology access to begin with, you can't go to work, you can't go to school. So some of the things that we've seen are the lack of technology and the tools to actually be able to go. So thinking about cell phones being able to, or being your primary device of healthcare anymore. In addition, like tablets and expanding the availability of those tablets in lower income communities and families to ensure that those folks actually have access. And in addition, it was working with tribal and indigenous populations to ensure that broadband expansion doesn't just hit rural communities, but also hits indigenous populations and lands.
Well, thank you very much. One of my follow-up questions that I wanted to ask is, when we talk about veterans getting vaccinated, very often throughout the certain states, there are VSO organizations that the VA is doing off-site vaccinations, going to the people. I wonder what your thoughts were on that, and if any of you've had examples of that going on within your organizations.
Sir, I don't mind taking that one. This is Jared Lyne with Student Veterans of America. We have we've helped form a coalition with a variety of veteran serving organizations led by the efforts in disaster recovery of Team Rubicon and their CEO, Jake Wood. We're bringing veterans together to help not only reach veterans, but really all Americans that might be outside of traditional vaccination sites, as well as staffing those sites with volunteers that can do everything leading up to the actual inoculation being provided into somebody's arm.
Thank you, Jared. Thank all of you. I yield back.
Thank you, Mr. Mervan. What I'm going to do is, I know that we have Miller Meeks. I'm glad to see you back, Dr. Meeks. You're not obligated to ask the questions of the Blinded Veterans Association, but I'm very pleased you're back. So I'm going to recognize you for your 3 minutes. And Mr. Mervan, just so you know, I'm going to probably go for a second round of questions. So members that are still here, if you want to ask another round, but I'm going to recognize you for 3 minutes, Dr. Miller Meeks.
Thank you very much, Chair Takano and Chair Tester, and thank you for putting me on the spot, Chair Takano. I am an ophthalmologist, and I was very interested in reading the testimony from Mr. Sampier. I'm probably mispronouncing it, so I apologize. But I can't say that I knew about the ocular trauma centers that you have referenced, but I did reach out to the American Academy of Ophthalmology and to our ocular research division or ophthalmic research division at the University of Iowa for their input on that. So I don't have an answer yet. But I would say my concern is that there is a tremendous amount of ophthalmologic research that goes on throughout the country. And it's interesting where you mentioned in your testimony the increase in trauma, ocular trauma, but as someone who trained residents, we have been seeing a decrease in ocular trauma on the civilian side. But to your point, during Desert Storm, I was called up, even though I had retired, I was called up to come back onto active duty to be deployed for the purpose of treating ocular trauma and IEDs related, ocular trauma related to IEDs. But my husband was deployed at that time. And since I was retired, I was able to decline. But I called back up as soon as my husband got back to be deployed. But at that point in time, they no longer had need of my services. So I can't address your question, but I will certainly continue to look into that. But my concern would be that we dilute the research that's going on in ocular trauma. And if we restrict where veterans can go for service, that does create a hardship to their families. So we need to be recognition of that. The question I have, however, in the time that remains to me is in relation to COVID-19. There are veterans who have a myriad of diagnoses. Some, they have service-related disabilities. And so I'm concerned. I have been approached, as I mentioned, I'm a Wapello County Commissioner. I've been approached that a veteran service member with a service-connected disability died on the death certificate because they had COVID-19 or were tested. Their death certificate has COVID-19, not their actual cause of death. So this is related to me personally, so I know that this exists. And so is that a concern? Do we have a problem with survivors getting dependent and indemnity survivor benefits when the diagnosis is on the death certificate, it's COVID-19, when it actually may have been a service-connected medical problem that was the true source and cause of their death? And with that, I'll yield back my time and I'll listen. Thank you.
Congresswoman, thank you for that question. Absolutely. We think that's something that we're starting to see from our members, boosting concern on that issue of getting recognition on the death certificates. And we think that's a real problem with over 500,000 deaths of COVID. There's a very, there's a lot to be reviewed right now in regards to the death certificate. So we certainly believe that taking a second look for that is essential to ensure that that DIC is getting appropriately given. Thank you.
I minimize my screen. Here goes. So thank you, Dr. Miller Meeks. I'm going to be, and Mr. Mervan, we'll be doing a second round of questions. And I'll recognize myself for 3 minutes for the second round. Mr. Zampieri, the Blinded Veterans Association is asking Congress, VA, and DOD to request the Assistant Secretary for Health Affairs to work with the United Kingdom to, quote, provide funding for joint ocular trauma task group that was established in a mutual formal agreement in September 2020. Can you explain more about the scope of the task group's work and the funding required to make the work successful? You were talking about that in your testimony. Go ahead.
Right. Thank you, Chairman, for asking that. It's a unique opportunity, and I do want to address the last thing. We're talking about military combat related eye trauma and translational battlefield eye injury research. So the Joint Ocular Trauma Task Group was established, and I spoke actually with the Surgeon General of the UK. And in Israel, about 14% of their casualties, by the way, are eye injuries, and historically going back 40 years. So their mission, quote unquote, is to look at best practices, clinical guidelines, standardization of formularies for eye medications that are utilized in combat zones, looking at surgical equipment, looking at training and education standards for deploying surgeons and the management of eye trauma. And then real briefly, we found that there's like the Hearing Center Excellence has $1 million. Again, it's not a huge amount, but if you're going to do these types of things, especially with the international group, you really have to have some level of funding. And so I appreciate the question.
Thank you, sir, for that response. Mr. Hilgert, in your testimony, NASVA highlighted the role that the VA and the state veterans homes could play in providing mental health care. This is obviously an important service for Americans, especially for veterans and especially in the wake of a pandemic. You also suggested that mental health services be designated a specialty care service instead of a basic service. Can you explain why it would be better categorized as a specialty care service and speak to NASVA's role in testing ideas before they expand to all veterans' homes?
Yeah, based on my experience, we're looked upon as a nursing home, and you have a per diem, you have so much, and you have an expectation of care. Even through great standards, you're expected to have 4 or 5 hours of care per day for skilled nursing. I think that's a 5-star goal. There are mental health conditions where you need one-to-one staff. Traditional nursing homes are not set up for that. When we have someone with, let's say, Pick's disease in one of our veterans homes and requires one-to-one staffing, you immediately throw the system out of compliance with your overtime. You have stressed on resources, and all of a sudden it's straining the resources of the nursing home. If it was a specialty care identification, it's our opinion that, okay, you have the situation within the state veterans home. We will help you resource it properly to address the needs of this individual rather than stressing the entire system. So that's kind of where I was going with that, Mr. Chairman.
Well, thank you. I appreciate that. I'm glad to see we have other members that returned for the questioning of our witnesses. Representative Cawthorn, I'd like to recognize you for 3 minutes.
Yes, sir. Thank you very much, Chairman. My question is for Mr. Titus. So I understand that Congress has provided the VA with tens of billions of dollars to help with COVID relief. It's over this last year. I'm wondering, have you seen any direct impact from that money? And how do you think the money should be spent moving forward?
I'll say, Congressman, thank you for that question. So looking at how VA has spent that money, we certainly see an impact and the way that the VA has been able to use it with the expansion of their workforce, getting ready to respond to the pandemic, providing some of the backbone that's necessary to help vaccinate our veterans and our caregivers. And along with that level of money, what we think is important also to ensure continuing oversight, because what we believe is that when we get vaccines in arms, our work on our the necessity to follow up from COVID isn't done. There's going to be a long process where we need to sit down and evaluate how the VA did from every aspect of it and digging in from every aspect, every benefit enterprise-wide. So we think that the increased funding, the personnel, and the has had a huge impact to make sure that from that funding aspect. So
excellent, Corey. It really means a lot to Mr. Titus. And Mr. Chairman, I yield back.
All right, thank you, Mr. Cawthorn, for returning after the break and presenting your questions. Mr. Lamb, I recognize you for 3 minutes.
Thank you, Mr. Chairman, and I appreciate all the witnesses as well hanging around for us. I won't really get a chance to question all of you in these 3 minutes, so I'm going to try to focus this for MOA and the student veterans. I believe in the wake of January 6th, there's a very
Mr. Lamb, hold on for a second. You're breaking up. Just
role to play for all that to
Mr.
police
Lamb.
our own and really talk about what the oath means.
Mr. Lamb, just I'm asking you to suspend until we get the technology.
I apologize.
I apologize. I apologize. Just hang on. You're asking an important question. If we could stop the clock, we turn the
I
clock.
yield back, Mr.
Just hold on. don't go away. Have we got the technology back? All right. Why don't you go ahead, Mr. Lamb, see what works now. Oh, can you turn you're muted? Can you turn back on your sound? Your mic?
I am a Marine, Mr. Chairman. takes me a little while sometimes with technology. I
Oh,
apologize.
I don't want to get into it with Mr. Bost over that comment, so go ahead.
All right. So my question is this. I think we all have a role to play in reinforcing the importance of the oath with our fellow veterans. The capital that the Constitution sets up was attacked, and we all swore an oath to the Constitution. So my question is specific to MOA and student veterans. What are you doing to identify whether you had members that were part of the attack, and what will you do going forward to communicate to your members the importance of the oath and the fact that this is not a political topic? If you swore an oath to the Constitution, there is only one side to this debate, which is that you oppose people attacking the Capitol. So if you could just update us on your efforts and specifically whether you've worked in with law enforcement at all.
Congressman, thank you for that question. And you take off the uniform, but you like you said, the oath never goes away. You have a responsibility to uphold it even after your leave. That belief is something that MOA holds dear, and it really is ingrained in our organization, our philosophy. So getting to your specific question, we've been closely following the DOJ's website and monitoring any individuals and looking at whether they were MOA members. We think that's important to uphold the standard of our organization and show accountability. Being a member of MOA is a privilege, and we expect our members to uphold the standard.
Congressman Lamb, this is an excellent question, sir. And thank you for your service in the Marine Corps. I serve in the Navy, so Department of the Navy friends will take that as well. Sir, this is an incredibly serious topic. It's incredibly important, and Student Veterans of America absolutely condemns the acts that happened on January 6th. Sedition and insurrection are serious matters and should not be taken lightly. Not only do we condemn them amongst all Americans, but specifically amongst all veterans. As to your question specifically, we've taken all publicly available data for those involved in the events of January 6th and run them through our database and verified that we have no current members that were involved. I heard you earlier ask a question regarding facial recognition. We don't have access to that technology as of yet, so we're not really able to do that. But had we found any members that were a part of the events on January 6th, we would immediately disband them from any of our national headquarters activities throughout the country, no matter where we're organized, sir.
Thank you to all the panelists. And if any of the panelists I didn't focus on, if you ever want to follow up with me on this, I'd be happy to talk. We just have limited time. And Mr. Chairman, I yield back. Thank you.
Yeah, Representative Lamb, just so you know, I have allowed for a second round of questioning. So if we get through the next few members, you might want to come back and ask other organizations the questions you want to ask them. So Mr. Murphy, I recognize you for 3 minutes, and then after that, Mr. Mervan, and then Ms. Miller-Meeks. If you have a second round of questions, you may do that. And then, but go ahead, Mr. Murphy. Go ahead.
Thank you, Mr. Chairman, and thank you to all the members of the panel. I thank you for your service to our nation and your continued service to our veterans. I represent North Carolina's 3rd Congressional District. We have the 5th most veterans of any district in the country, and it's growing. And so Veterans Affairs are very, very important to me. I, as a physician, have worked at VA medical centers and have cared for veterans, and am deeply obligated to all that we can do to care for those who have dedicated their lives and sometimes made such great sacrifices, and obviously the ultimate sacrifice for us to remain free. I'm going to throw one plug in here for House Resolution 1014. As a surgeon, I've dealt with wound healing for over 30 years. And I look at our particular population of veterans who come back with traumatic brain injuries, PTSD, those who have suffered from blast injuries, and from other effects during their service. And we do a fantastic job in the VA of reaching out to those veterans and trying to help them cope with the struggles that they cope with. But I think we can do more. There is a significant subset of individuals, despite all the modalities that are offered to them through the VA, that still we cannot reach, still are not able to get their life back on track, still not able to participate fully in society, still not able to get jobs, deal with family. We have obviously such a suicide epidemic in our nation for veterans, over 17 a day. And so what I've used for wound healing when nothing else has worked is something called hyperbaric oxygen. Hyperbaric oxygen has been shown to help promote wound healing in these individuals. And I will say this very objectively as a physician, this is not necessarily mainstream. I want this issue studied for our veterans. What hyperbaric oxygen does is it promotes wound healing. And I think in a significant subset of individuals who have suffered from PTSD, who have suffered from TBI, this is from blast injuries to the brain. This is a wound that despite pharmacology, despite interventions, objective interventions and therapies, we still are not reaching these individuals. Hyperbaric oxygen therapy, I have seen and witnessed firsthand with some veterans who literally had nothing else to be offered, have changed their lives, have made their lives whole again. And so House Resolution 1014 asks for a pilot study. I am asking each of your groups to please study this and please consider supporting this measure. We need to do everything possible. We need to leave no stone unturned to try to help those who have suffered in service to our nation. So thank you, Mr. Chairman. I would ask each of these groups, please, House Resolution 1014, I would ask for your support for this as we move forward. Thank you all, Mr. Chairman. I yield back.
Thank you, Dr. Murphy. I'm going to recognize Mr. Moran for 3 more minutes.
Thank you, Chairman. At this point, my question is for Mr. Lyons. In your proposal or in your statement, you had said the GI Bill is the front door for the VA. And my question is, I understand that the VA recently began evaluating the modernization of the GI Bill information systems. Can you describe for me what any engagement you have had with the VA on this topic? What do you feel are the biggest concerns that the VA should consider as they address the future of the GI Bill information system?
Okay. So thank you very much. I'm not sure.
Can we just hold on for a second until we can straighten out what this all right, go ahead, proceed, Mr. Lyons.
Thank you, sir, very much for the question. When we think about VA IT modernization, these are things that, frankly, should have been done and addressed a long time ago. With regard to direct interaction with VA leadership, it's actually been strong. VA is committed to trying to resolve this issue. The support that they can ultimately receive is the ability to ensure that funds that are allocated get actually used for the right reasons. Because broadly, this notion of the VA having an idea or embodying an idea that the GI Bill is the front door to the VA, it helps people sort of understand that the VA does not reach all veterans and is chronically having the challenge to be able to do that. And we find that nearly 60% of the transitioning force is in a college classroom within 7 months of separating from active duty, utilizing the GI Bill. Frankly, it's the first and in some cases the only interaction that they'll have with the VA. When IT systems are not caught up to modern times to be able to process those benefits and provide a good experience on the front end, the veteran is left with a mistrust of the VA due to that interaction. And then down the road, when the veteran may have an issue, be that emotionally, physically, regarding their mental health, they might not necessarily think to reach out to the VA. Further, if they have the relationship with the VA through the GI Bill, through IT modernization, the VA could actually explain to recently transitioned veterans all of the benefits that they may be eligible for in the entirety of the VA ecosystem. The VA has a lot that we can provide. By treating the GI Bill as the front door, we can actually access and make newly transitioned veterans aware of all that the VA has to offer and truly provide that care to our veterans for life. Thank you, sir.
And I thank you, Mr. Lyons, and I thank all of you as young veterans who are on advocating for your peers, how important that is, especially in the Veteran Service Organization realm. So I appreciate that, and we'll make sure that they're, as the front door, we use technology to link together the benefits along with making sure we are pushing out information so we have more people aware of the VA and using technology and modernization to do that. Thank you.
Thank you, Mr. Mervan. Are there any other members who I've missed who would like to be recognized? I don't see any other members seeking recognition. Let me thank all of our panelists for your testimony today. And we look forward to working with you and your organizations and your members in the future. So we're very grateful that you all participated today and brought your voices to the table in the room where it happens. So all members will have 5 legislative days to revise and extend their remarks and include extraneous material. Again, thank you all panelists for your presentations, and this hearing is now adjourned.